Corinne Mori, thanks again for joining. And this time we're going to have a longer conversation. This is something I've been wanting to do for some time. I'm just trying to work out the schedule. I know you have a bit more of an open schedule. We'll get into why that is. I've things are crazy. Things are crazy here in British Columbia, and you're a nurse here in British Columbia. And why is it that you have such an open schedule?
Oh, well, currently I've had to change my career. I'm not allowed to work in this province as a registered nurse due to the mandates that are still in place in this province. And I have decided instead to focus on being a revolutionist instead of following all my nursing friends into other provinces to work as a nurse.
So I got in touch with you and we did a video together and we were talking about I wanted to get into Bill C-30 or Bill 36, sorry, in British Columbia under David Eby when he first came in for the NDP. And you opened my eyes to like a lot more stuff that was going on that I had no idea. And I'm hoping we can get into a bunch of this tonight. And before we get too far into it, for the audience watching, you put together a whole hour-long video, and it's chocked full of information, so much in there. Joe's got it up on his screen. I'm just gonna put this up there, and this is in memory of the BC Nurses Union, as you've titled it aptly. You actually had access to a casket. Well, not many people do. I would have just photoshopped this, but yeah, you've got some particular access. But tell me a bit about what's in this hour-long video. It's incredible. You have so much information in there. Let's just get into it. Let's talk about what this is all about.
Thanks for letting me share this story. It is a bit of a longer story, and so feel free to jump in. But what I've uncovered is that basically healthcare and the nurses were the first people that encountered the oppression that is going on by our government. And so as a result, we've been the ones who have had to navigate and maneuver through all of the protective mechanisms that should be in place in our province in order to respond to this. And as a result, we have uncovered many layers of things that are extremely concerning. And as a result, I like you said, I made that video because there was just so much documentation and storyline that was involved in this. And so I'm not going to go into all of that evidence in our talk. And so if people are interested, I did put it into the YouTube video, and feel free to go through it and highlight some of the things that I am exposing there.
Yeah, absolutely. We'll put it out there. It's in the description for everybody to check out, so they can check that out.
Thanks. So my story started way back the summer of 2021. And this was when I had already been working during the first year and a half of the pandemic. I worked in the emergency room, the medical units, the COVID medical units, which had all been shut down because there were no patients, home care, long-term care. And I was doing all these positions as a casual nurse in Nelson. So I was very exposed to all the different areas of healthcare in that city. And I was seeing a lot of this systematic changes that were being pushed into the healthcare system during a time when we were being told that there was this significant pandemic occurring, but we just weren't seeing that firsthand. And I was in communication with nurses all over the province. The story that I have is not uncommon. And
I just have a question actually about that. So
yeah.
the idea, so when the pandemic first started, and a lot of people have forgotten about this, but then when they're reminded of it, it's like, yeah, right. We all started seeing TikTok videos of nurses and empty hospitals when we were told you can't go in for your checkups, you can't go in for this and that, you can't go in for cancer screenings, hospitals are shut, no go, you can't do it, and everybody's got to stay home. And the narrative was 2 weeks to flatten the curve, right? That's what we all heard in the beginning. And it was like, okay, we'll deal with that. And then 2 weeks turned into a month, turned into 2 months. And then we're hearing about the lack thereof, the surge in the hospitals. And what was your experience there? Because from our perspective, a lot of people were angry when they saw nurses doing nothing.
It's totally accurate. So, I mean, during those first initial months, they shut down all the ORs. Nurses were being deployed to go stand guard at the front door and be your door greeter and not allow anybody in. And so we have all these qualified nurses and physicians who should be providing healthcare, and everything was shut down. And people were afraid to come to the emerge. Definitely numbers were down as well. And as a result, we found out, by the following year, that there were many people who ended up in acute aggressive illnesses because they had been not diagnosed in a timely manner when they could have been treated initially.
So
But
you're talking about things that were not to do with COVID. You're talking about
yeah,
other.
so yeah. If you all of a sudden were feeling chest pain or abdominal pain or had issues, people were just too afraid to come to the hospital, and so they weren't getting diagnosed in a timely manner. And as a result, there were many people that ended up not being able to get adequate health care in a timely manner because of all these basically this messaging coming out that the hospitals were overrun with sick patients, and it just wasn't the case. In my there was one time where I actually put on Facebook that I had seen more adverse events from the vaccine than in 3 days than I had seen COVID in a year and a half. And within 24 hours, I was suspended from work for a week.
Oh wow!
And
Oh, okay. So like your
yeah,
job, you're not
yes.
suspended from Facebook, because we've all heard about
No,
people.
I was suspended from my job from Interior Health for putting that on Facebook, and they had to bring me back because on the Facebook post I didn't say that it had happened at work, and so they couldn't use that for a work-related issue, even though that was the case. It was at work, but when that happened, when I saw that it was more important to the health authority that they maintain this story than they were in exposing what was really going on, that's when I started getting very suspicious. Now, in my case, I had been totally expecting that I was going to get the vaccination, but because it rolled out so quickly, and I knew that there had not been adequate trials and research done on it, my position was that I was going to wait for a year before I took it, because I wanted to actually make sure that it was effective before I took it.
Yeah,
In the
that's fair.
meantime,
Absolutely.
I kind of thought so. In the meantime, I ended up being exposed at work twice from to COVID, and at that time you were notified by public health through contact tracing. So they phoned me and told me I knew who the people were, and both of them were double vaccinated nurses. So this is the summer before the mandate. So I'm already seeing that obviously whatever they're giving is not stopping infection, because healthcare workers were testing positive, and then we're all having to be notified. So I'm seeing it's not working. I'm honestly seeing people coming in with adverse events and injury. So the kinds of things I was seeing was anaphylactic shock, neurological issues.
Can you explain what that is? I don't know what anaphylactic shock is.
Okay, so anaphylactic is like if you have an extreme allergic reaction, and so your airway starts swelling up, you get hives all over, you potentially, if it gets bad enough, you can suffocate. And so these people were brought to emerge in the event that their airway closes up and they need assistance. We had people in there who were all of a sudden losing motor function, and not having control over their limbs anymore, people that had issues with being able to speak. And these ended up being long-term. I'm still in contact with people now who 2 years later are still significantly injured, unable to work. There's no disability for them. The government is refusing to give them any kind of compensation for this, even though they were told that it was to be safe and effective, just like YouTube tells us.
Just like
that we're
YouTube is
safe.
saying, and we have an obligation to tell everyone that it's safe and
Yes.
effective, and you have you know nothing about this YouTube's algorithm or YouTube's terms of service, and lawyers, they
Yeah.
know more about it than any of us, but this is just conjecture for
Yep.
the moment, I guess, you know, one
Yeah.
professional to a podcaster. But this is I mean, this is the world we live in now, where you can get in trouble for saying the wrong thing in the wrong circumstance. You obviously, and I was surprised to hear that it was not Facebook that gave you trouble, but your job for something that you said on Facebook. Yeah, going to show that they're what kind of forum were you in? Why was your job paying attention to your Facebook feed, or were you reported by somebody? How does this work?
You know, I don't even know, but later on in the fall, I participated in a protest in our local community, and I gave a speech that was recorded, and basically the recording of the speech was me reading out the ethical practices that nurses are to abide by, which is fundamentally that we have to protect your right to your choice in medical interventions, and we are to support that. So a physician who was not present at the protest put in a complaint to the BC Nursing College about me, and put in the complaint that she was not present at the protest, and because of her mental health issues, she didn't feel that she could actually watch the video of my protest, but that I was giving misinformation. And I ended up having to go through this huge investigation with my college. And actually what they do is they record everything on my Facebook page. And so periodically I will get a file that has 6 months worth of my Facebook posts on it.
Oh, wow.
And I actually had to hire a lawyer to protect myself. You know, eventually it took 9 months. The college came back and said that there was no evidence to justify this. But in the meantime, I was again suspended from work for a week, and the union has still not followed through with that grievance to get that money back from me, even though I was deemed to be not guilty of what she said. But
this is an assumption that this person made. It was an assumption that she made, and she refused to watch the video to see because it was triggering. Yeah. That's like,
yes.
Oh God, like this is
so.
This can't be real. This can't be a real thing that we're
it
dealing
is a real
with.
thing. You can currently make false accusations that throw healthcare professionals into these huge investigations. And we have to hire lawyers ourselves to protect ourselves, to actually make them investigate things appropriately.
So why
that is the reality.
Why does anyone get into the trade then anyway? Why?
Well, and you know what, this Bill 36 is going to make things even worse. But I'll go back to a little bit earlier in the story and work my way up to this, so that it all sort of
I'm jumping the gun.
Oh, that's okay, because it's all pieces that are like, you know, it's just,
well, everything's so scattered in my head too, right? Like I'm looking back at the pandemic, and it comes back in pieces, right? It never comes back as one whole congruent story that starts here and ends there, because we all have lives to live, and we're still trying to deal with our lives, but all of this stuff happened, and it's such a traumatic experience because it sent so many people on such a different path than they were on in life, and now they're in a completely different place. Look at me, I'm making podcasts and I'm talking to a nurse on the internet. I mean, I thought I was just gonna be a mechanic guy, just pulling wrenches, the same as I always did, you know. But here we are. We're in a totally different walk, and it's because it's so compartmentalized. I can't I can't put it together in one congruent story. But I'm sorry, I cut you off, and we're going all over the place. Let's get back to where we were.
Well, I think it's fair to actually, we need to address, where we are as humans. And, the facts were back then, the summer of 2021, nurses were, by and large, at least half of us were up in arms about being coerced into a medical procedure that up until this point, we were protecting the rights of people to make their own choices. And eventually, most of them caved because of the pressure of losing your job is significant. And I want to just highlight that I totally appreciate the fact that as humans, we need to feel secure. We want to feel secure. We want to be able to take care of our families. And, it's because of these characteristics within us that we choose to do things that will benefit our families, but not realizing that long term, it actually destabilizes us as a society. And then we end up with bigger problems. And so, at the beginning, we weren't going to be able to anticipate the ramifications that was going to occur. And now we're farther along in the story that now I've been able to see, oh, wow, like there are significant foundational structures here that are no longer in place. And so this is why now I am coming more to the public about what I know, because it's not just nurses that this is impacting. What I've discovered is that basically every worker that's in BC is moving into a time frame where the government is going to have the jurisdiction to tell you what you have to do in order to work. And so I'll start the story just to give a bit of a background. And I'm going to go into a lot of sort of the union mechanisms, because this is important in terms of employment in our province. And yeah, we know there's a healthcare issue. We know that the decisions that the NDP government has made has basically caused this collapse. But it's not just healthcare that they are weaving this into. And there are things that I just want to highlight so that people can be aware and pay attention. So when I'll give a quick little history on the nurses union, because this part is important in terms of why nurses were opposing this coercion, because it's not a matter of that we're not keeping people safe. That wasn't the facts. And so I'm going to go back to like mid 2015-ish. In place at that time in many provinces, there was what was called a VOM policy. It was a vax or mask policy. And in that earlier in those years, it was recommended that you have an influenza vaccination annually. And if you chose not to, then you would have to wear a mask for the duration of the flu season, which could be anywhere from 4 to 5 months. The Ontario Nurses Union was the first one to take it basically to court. It's not really court. Whenever you're dealing with unions, you're dealing with labor boards. So they took it to arbitration and said, there is no scientific evidence to prove that these vaccinations are actually reducing transmission, and there's no evidence to prove that the masks are stopping transmission. And so they submitted expert witnesses, scientific evidence, and it actually had to go to arbitration twice, where they were fighting the province of Ontario and the employers over this policy. But both times, those arbitrators ruled that there was no evidence to justify making nurses wear masks. It didn't reduce transmission. And it also was looking to be more of an optical thing, because it wasn't a scientific thing. And so as a result, the Ontario Nurses Union was able to shut down that policy. So if you didn't get the influenza vaccination, you no longer had to wear a mask. Now, same thing was happening over in BC. And every year we have communications from our union stating the exact same thing. 2015, 2016, we are adamantly opposed to mandatory vaccination and having to wear this mask. And so after the ruling from Ontario in 2017, the BC Nurses Union filed what's called an IWAD. It's an industrial-wide application dispute. So it's a formal challenge, and it was against Bonnie Henry and the Ministry of Health and all the employers.
Mm-hmm.
And they also took this to arbitration. And it came back in 2019 that policy was now changed. The mandatory vaccination and the requirement to wear a mask was overturned. And the policy was that no nurse could be disciplined for not getting vaccinated or not wearing a mask.
No,
so that
Bonnie Henry was just on TV, like a couple of weeks ago, saying as if that never happened. She was saying she has no patience and for those that are listening and don't know and aren't in British Columbia, Bonnie Henry is the public health officer. She's like the Teresa Tam of British Columbia. And she's saying that she had no patience for medical professionals that don't have the vax. She said, we have had vax or mask mandates for the influenza for years, and didn't state any of the stuff that those were under, there was conjecture, there was lawsuits, they lost, and it didn't actually go through. She had nothing to say about that.
Yeah, I know. It was challenged and overturned. Now, some people might go, well, influenza and COVID are not the same thing. Actually, they are. They're both respiratory illnesses. They're both treated the same. When you come into hospital, they're going to have the same isolation precautions. And as well, worldwide, they were using the already established influenza surveillance systems to monitor the COVID spread. So it was all under the same umbrella.
Mm-hmm.
So now we have an issue where, we've just gone through all of this arbitration where the policy is that we're not supposed to be disciplined. And then we move into Bonnie Henry saying, well, you know what, we're going to have to actually not allow these healthcare workers to work because the PPE that they've been wearing isn't effective. While she tells the public, while you go out with your cloth masks that have no protection at all, you have to wear that in public places because it's going to save your life. So the inconsistency for somebody who's educated was like this. Obviously, from our perspective, was that we were not encountering this to be an actual health issue. It was turning into a political issue. And it didn't make sense that it was proceeding in the manner at which it was going. So we all assumed as nurses, well, obviously the union is going to step up for us. Now, when
did they make the change? When did they make the change? When did they say that we're all masking now? And because I remember Bonnie Henry, she was on the news. She said, it's not important. Actually, if you wore a mask, you would end up touching your face too much, and you would end up inoculating yourself in that way. And then she turned around and said, no, I've always said wear masks. This is, I've always said you should wear masks. You should wear them all the time. This is just their new point of view. Corinne, could you come back into the frame a little bit? We've got you're slipping out into the, There we go. Sure. There we go. We want to see all of you. All of you. But when did that change? So it was a hard flip too, and it seemed to coincide with in the United States as well. You had Anthony Fauci, who was saying at the beginning too, no, masks aren't going to make a difference, especially if they're just cloth masks. They make no difference. If you were going to wear masks, it'd have to be the N95 masks, but they don't really help you against respiratory virus that's out in the air. It's more to just help keep, moisture or whatever going into a cavity when you're performing a surgery, that sort of thing. And they were saying that it was pointless to do, and then they all switched. When did that happen?
I'm thinking that was way back in 2020, because I know that the requirements in healthcare were different from the public. So I remember that we quite early on had to start wearing masks all the time versus before it was only when it was something that was airborne. So if somebody was coughing or sneezing, then we would put a mask on, but we would never do it for healthy people. And then all of a sudden now we were having to wear them all the time, which was interesting because part of that IWAD that I
What a
was talking
name,
about
right?
before,
I want.
yeah, they were able to prove that unless masks are changed every 5 minutes, they're ineffective. The moisture buildup gets too much, and then things aren't protecting anyway. So that was one reason why they were able to get rid of that policy, because nurses would have to change it out every 5 minutes for it to actually be effective.
Well, not to mention, like,
So then,
people who are wearing these masks, they're wearing them, day in, day out. Some of them, like, they're just sit in their car and then they'll put them on, or the cloth ones,
oh yeah,
they go in a pocket, and then they go back on the face, and they go in a pocket. A lot of people neglecting to wash them. Like, let's be honest, that's the truth of it. I mean, how much more dangerous is that for not just COVID, but like other respiratory things, other just bacteria things? It's just a hygiene issue, would it not be?
well, I mean, I guess what I found the most frustrating was this line of trust the science, trust the science.
Mhm.
And the science had already told us that that was not effective. And it was surprising to me that the health authorities were falling in line with this when they knew better. Now, I did find out later what was actually occurring behind the scenes, but it took a while. So I'm going to explain just a little bit about union process, because this is important in terms of just worker rights in our province.
Mhm.
Currently, right now, 1 in 3 workers are unionized. And so what that means is when you become employed by a sector that requires unionization, you don't have a choice. Other countries, US, Australia, Europe, it's voluntary. You have a choice if you're going to become a union member. In Canada, it's mandatory. And so then you get hired, you become a union member, and as soon as you sign on that line that you're a union member, you legally give over your right to any employment representation to the union. So it means you no longer can go to your employer and discuss any issues you have. It has to be done through the union. So then you're reliant on the function of the union to do its job. So we have a thing called a collective agreement, which is you have the union representing all the workers on one side, and on the other side, you have the employer. And every 3 years, they come up with the rules of the game, which is called the collective agreement. And so it's to make sure that everybody's following the same rules. And then if at any point the employer is not, then it's the union's job to step in and hold them accountable. Now, in terms of bargaining, you have, so, when this agreement process happens, for the unions, there's an entity over them that's called the Nurses Bargaining Association. They're the ones that do all the union side of the bargaining. And on the other side of the employer, so you're talking all your health authorities, and there's over 200 private organizations that provide healthcare. They have an organization called HEA-BC, which is the Health Employers Association of BC. That's the entity that does all of the bargaining for the employer. So when the public health order came out, Bonnie Henry didn't actually say that healthcare workers had to be terminated. She just said that they couldn't work. And then when the termination started, we discovered that it was HEA-BC, so that's the entity over the employer, that told the health authorities that they had to terminate.
I just want to make sure I got this straight. So the HEABC that you're talking about it's basically a union for the hospitals. It's their union.
It's the guys, that do all their labor relations and all of their
but they do a
contract
collective bargaining on their side of things. So you have collective bargaining from union reps for the union members, and then this organization for the hospitals. And then where does the government fit into this whole thing? The government just oversees it all, or what?
Well, the government appoints people in the HEA-BC. So the government appointed directors to the HEABC. The HEABC then gave direction to the health authorities that they had to terminate all the unvaccinated, which was against the collective agreement and against that policy that I told you was just amended.
Mhm.
So here the employer now has broken the rules, and it's the union's job to enforce it.
But the
Except
hospital on that side of things, do they care? Like, are they like, did they say anything about this? The individual hospital saying, we don't care, we'll
the
take them,
hospitals,
we'll let
yeah.
them work.
No, all the hospitals just said we have to do what we're told.
Just
So
following orders. Okay, gotcha.
just following
Just
orders,
following.
even
Yeah,
though they
that's
knew that none of what we were doing made any sense or followed any of the historical isolation precautions and mechanisms that we'd use, and the fact that we had already been through a year and a half of this pandemic using the same people, and there was no problem. Like, I mean, if they could have come up with one healthcare worker that died from COVID that was unvaccinated, I'm sure it would have been in the news.
right, right, because that was the narrative that they wanted to push. Right, right. So it didn't happen. Didn't happen. And
Didn't happen. So then we start getting people being terminated. And so then it's like, okay, it's the union's job to protect us because they're making a ton of money. Now, in our union's case, it looks like their revenues are 60 million a year, and they're running assets of 565 million dollars. And their only role is to protect their members. So we thought, okay, they're going to step up. Well, nothing happened. And there was like silence. And it wasn't till months later that we discovered that the president of this union in September resigned. The vice president went on health leave. The CEO that they hired for bargaining, he went on leave. We were having regional reps on leave. And basically the only person working for the 4 months while all these terminations was happening was the accountant and some very inexperienced stewards that were kind of the frontline level, but very ill-equipped to deal with something of a magnitude of this crisis.
is there a
And
protocol in that
so
case where, like, so for example, if they're all gone, their officers are clear, is there a protocol
yeah,
for union members to file grievances with
it was just not operational. So we would get a letter stating that the grievance was filed. So a grievance is a 3-step process. So when a termination happens, historically, you have step 1 where you have a meeting with the employer. If they don't back down, you get to a step 2 where again we try to get a resolution. If that doesn't happen, it goes to step 3, and any termination would automatically go to an arbitrator within 90 days. And so a third party would get involved to be able to make sure that the person was well represented. So we get these terminations happening, but nobody's working. And like, no, in a union that has over 250 employees, there was like nobody.
Well, this is
Nobody
insane to
home.
me. Okay, so my perception of what unions were was because of my growing up. I grew up in Windsor, Ontario, union town. There are pretty strong unions there with the auto sector, and not only that, but all my teachers when I was growing up, they were a union, and I had a few pretty horrible teachers growing up, and they couldn't get rid of them. They were problem teachers. The parents knew about it. The students knew about it. The other teachers knew about it. The principals knew about it. School board knew about it. And it was like, well, what do? We can't get rid of them. The union will just keep them in their job. So for me to hear that the unions are just like, nope, not going to deal with this, fired, not even going to, that's just foreign to me, that concept. Because unions are always so hard-nosed. They've always been my entire life when it came to even like bad actors, let alone people who are just being let go because of some arbitrary rule because of a vaccine.
Mm-hmm. Well, I mean, in my case, I came to nursing late in life. I was self-employed. I did a couple of businesses and we were in construction, and I just graduated when I was 50. And I had the same sort of perception as well, that unions were really just protecting the lowest common denominator and not really giving any kind of encouragement to those who have some incentive and really try to excel. So, but the reality was like I said, you don't have a choice.
This is the
have to
career path you
become,
wanted to go for, and
yeah.
you're stuck with
So
it.
you're stuck under that umbrella. And it was just now that I've also discovered that, interestingly enough, unions are nonprofit organizations, and as a result, they do not have to declare or file income tax. So, like I said, our union this year, well, since 2017, they went from 265 million up to assets of this year, 565 million in assets. I don't know
When you
how.
say assets,
I
what do
don't
you
know how.
mean? What do you mean assets?
Well,
Like cash?
exactly.
Yeah,
Like
it's not
cash, property, stocks, but we've asked for records of what this is, and they won't provide it. And so
even to their
when you
members,
go,
paying
even to
members.
their members. So in BC, there's different rules across Canada in terms of what disclosure is required by a union.
Mm-hmm.
Actually, BC is one of the more stricter ones, but even at that, the requirement is that the statement only has to be audited. It does not mean it actually has to be verified. So I'll explain that. We got copies of 5 years worth of union statements, and the front page on every one by the accounting firm KPMG stated right on it that this was a qualified opinion. And what that means is that they were not actually able to verify any of the revenues. And so as a result, any of the other calculations that they made, they cannot confirm. So basically what that means is the union gives them numbers, they make financial statements out of those numbers, and they don't have to verify that the numbers are true. And this is industry standard. Now, this is what I mean by the reason I'm bringing this up is because this isn't just the BC Nurses Union. This is every union in our province operates under the same disclosure rules, which means whatever they tell you in the financials does not actually have to be a forensic audit, something that's verified. They can just provide whatever numbers they want, and that's acceptable. So that was news to me. Also, the fact that we were consistently asking for records or verifications or statements that this money that they have actually exists, and they refuse to provide it. And they're allowed to refuse to provide it. Even though I am a member of this society and my dues are in there, I am not allowed to see what they're actually spending that money on. So historically,
what if you were to unionize within the union? Sorry.
oh, trust me, we've been brainstorming all sorts of ideas.
If you're to organize the labor so you can see what they're doing to your dues. Oh God, this is just it's going so deep now. It's so deep. I mean, it's a government within a government at this point. No, but for real, like it's a government that's you've got this organization that's over you, that the whole purpose of it is supposed to be to protect you. This is the whole idea. When people say no union busting, they're like, no, unions are there to protect the workers, but they're not doing that. They're not protecting you. They're putting you in a situation where you now don't even have a right to file grievance with your employer directly. It's all through the union, through this other union. You're working for the hospital, but you're not working for the hospital. You're working for the union, which is working for a conglomerate of hospitals organization. This is, I mean, it's a bureaucratic mess, to say the least, but it's done in a way that negates the initial purpose for why it exists in the first place. And this was so frustrating to hear.
Yeah, especially now, because in the last couple of decades, there has been quite a bit of construction on employment law. And I don't know if people realize that if your collective agreement is in opposition to something that's already in employment law supersedes anything in the collective agreement.
Explain
So
that. Explain that. How
basically,
does that work?
so it means the laws that are in place around employment now are really enough to protect the worker. So
I
again, we
see.
go back then to what is the function of the union? You know, they can come up with all this collective bargaining, but really it comes down to, if there is a big enough issue, it's going to come down to whatever the law says. So again, the function of the union is to enforce that the employers play by the rules. So we get into this now, we notice, you know, as soon as the termination started in September of 21, right up until last week, there was not a peep in media or from our union about the terminated healthcare workers, except I think there was one, Dick said that there was like 2,500 healthcare workers that have been terminated. But other than that, every story that had to do with we're closing ERs, we have critical nursing shortages, we're closing medical units, we're having to transfer patients from one hospital to another because there isn't enough staff. Not one of these stories was ever parentheses within, oh, by the way, that's because we fired all these people.
And that's what everyone's screaming when they're reading these articles and they're watching these news reports, and they're saying, "Oh, so we're not doing weekends at the Emerge this week, or for the next month or however long. We're not going to do that because we have this massive shortage." And you have people screaming from the rooftop saying, "Hire them back." Why?
Well,
Why is this?
Then we started having people die in waiting rooms, and you know, I was in contact with nurses that were still working, and it was becoming it's nurses were being required to work massive overtime. For instance, I'll give you an example. Now, when I was working, so that was a year and a half ago, 12-hour shifts. You can do 4 as a casual, 4 in a row, and then the 5th one would end up being overtime. And a 6th one you were not allowed to do because of a fatigue policy. And they enforced that. They would not let nurses work past 5 days in a row because the potential for mistakes to happen increases.
Kind of like truck drivers, they have to have a logbook and they can only have so many hours on the road.
I've just talked to a nurse who's doing 12 shifts in a row right now.
12 shifts in a row. And how are they getting around these requirements? Okay.
Because they're so short-staffed.
So they still have the requirements. Like, you know, your trucking company's like, we're just so short-staffed, we're going to have to go and supersede the rules of engagement. We can't have you resting. Sorry. Here are a couple of roofies like back in the 70s and go for it. Head out onto the road. It's insane to me. They're just ignoring
So then, you know, people talk about, well, the numbers aren't that high. Okay, so I'll give you a piece of data that I picked up. So all of us have to have a license to be able to practice in BC. Mm-hmm. So you can go get your post-secondary education. You know, in my case, I graduated 2015 with, you know, my honors because I'm actually pretty smart. And it doesn't matter. It doesn't matter that you actually have a degree in something. The only way that you can actually work in your province is if you are licensed. And so then our licensing body, now I'm just thinking the licensing body. So every year we have to pay an annual fee. It's like $600. And so the union had made some agreement that the union would actually reimburse through by the employer $200 per license. So I actually went into the data of how many reimbursements they did in 2022 versus 2021. And they reimbursed 4,000 less licenses in 1 year.
Is that just because they're not in the field?
Anyone that is going to have to pay for something, if you're able to get free money, you're going to apply for it.
Yeah, you're going to get it.
So there was 4,000 less requests, which indicated to me the ones who took early retirement. Because all of us who were still wanting to work were thinking that things would change. And so we still took out our licenses, and the terminated. So we have a couple of numbers of terminated, those who went on early retirement, and those who were taking stress leaves to be able to take time off until things sort of readjusted. So
now I know we're going to get into this a little later, but the nurses that went into other provinces to work, do they have to get a license within that province that they're going to, or do
yes.
they? Okay, so that's
every single province you go to, you have to get another license.
Okay.
Yeah. So our numbers were showing between 6,000 and 8,000 less nurses. That's just nurses. We're not talking all the other healthcare professionals, the doctors,
Right.
the lab, the housekeepers, all of that, just the nurses, which is equivalent to, for sure, staffing Kelowna General Hospital. So saying that we weren't...
There's that many staff at Kelowna General Hospital, 4,000 staff?
I would think that's probably reasonable to make that.
That's a big hospital then. That's huge. That
Kelowna Hospital. It's our regional hospital.
Oh, I've never been. Okay, so that's humongous. Yeah. That sounds like a big facility.
It is huge, yeah. So then we get into the spring. We realize that this union isn't doing anything. It isn't progressing our grievances through, even though they have a time frame that they're supposed to work in. And really, the only legal mechanism we have then is through the BC Labor Board. So as a unionized worker, you cannot use the court system. You have to use the Labor Board, and they have all sorts of rules and a process that you have to follow. And so we did a Section 12, which is basically accusing the union of failing in their duty to represent us, and that their treatment to us was discriminatory and arbitrary. And so over the summertime, we were compiling all of our data, and I was sort of the central hub for that, for the construction. We did hire some legal consultation to help us, but because we're all unemployed, we can't afford that. So basically, to keep our costs down, I would get direction from our lawyer. I put the bulk of the material together. He would review it, and then we would submit it. So I was very familiar with all the content that was being sent to me from all the different nurses. And that's when we started putting all of this picture together. So we submitted those complaints end of September. Now the Labor Board has 180 days to actually bring this to conclusion, and we're almost 120 days into it, and we have not had any direction yet of what they're going to do with our cases. So I find that a bit interesting. Come September, so we've got our...
Wait, before we go any further, so the Labor Board now, we've introduced a new entity. The Labor Board is a governmental organization with bureaucrats appointed by who?
That's a good question. I haven't looked into that. I don't know if they're appointed or if they are, if it's a hiring process.
But it's a government organization. So it's the government. The government is mandating that these mandates go, mandating that you have to have these vaccines in order as a terms of employment. You file a grievance. The grievance goes to your union, which has been inept and flaccid. And that goes then past that into a dispute with the Labor Board, which is essentially the same people that made up the rules that are kicking you out of your job in the first place.
Well, they are supposed to be, a fair arbitration.
Oh, okay. Fair, equal representation. Right. All the platitudes. Right.
We've submitted 6 so far, and they haven't given us notice on any of them yet.
Yeah, so forgive me if I sound cynical about the prospects of that being a fair situation. You're not allowed to use the court system. And I've heard of this. The more and more I get involved in these political talks and talking about people with these political situations, the more I hear about these kangaroo courts, these boards, these tribunals, these other extrajudicial bodies that they come up with in order to avoid going to an actual judiciary, a court of law, where you actually see a judge and it's an independent body. Like they're saying, oh, well, we want to alleviate the courts from having such a burden. We need the courts to have the burden. This is the point. Because this is the situation we end up in. We end up in these like conflict of interest scenarios where people are getting shafted completely for arbitrary rules, and then here we are. Like, what are we doing?
Yeah.
What are we doing?
Well, and it's problematic because, you know, you put in your application to the labor board, then there's a decision that happens. If you're not happy with that, you can appeal it. And then it has to go through another arbitration. And it's only at that point, if you're not happy with the labor board, that then you can proceed to court. Now, I've just talked to somebody who is going through the same process, but it's taken 4 years for her to go through that process.
So it's just, it sounds like it's designed to just wear you out before you can even get to a court. So you just give up, go pound sand,
it gets delayed,
do something else.
Well, and in her case, she ended up finding a lawyer that saw the injustice of everything. It was just so blatant that he decided that he was going to help her and do it pro bono. But I mean, they've racked up $100,000 in costs. So the ability for you as an individual to get a fair hearing, if those systems don't work, and you have to go to the courts, and how delayed and costly everything is, there is nobody in this province that actually gets justice, because the legal system is set up to rob you and to delay and to play this game so that it's about lawyers doing their finagling rather than actual justice occurring.
Yeah, and they'll make a profit.
Now,
they make a huge boon, right? They're making a lot of money in this whole racket. They're happy.
Yeah. And so then we move into November, and so that's now just this last November. And we noted that the union was going to have their annual convention at the Hyatt Regency in Vancouver on November 2nd. And we decided, well, we might as well go. They've stopped communicating with us from July. They weren't responding to our emails. They weren't, responding to phone calls. And so we thought, okay, we'll show up in person. We decided the day before to let them know that we were coming, because we're professionals and we're courteous. And we just said, look, we need to be able to speak to the membership and to the executive to find out what's going on. And we're going to come. Can you give us some time? And their response when we showed up the next day was that they had security at every entrance to the convention. And there were other conventions going on in the hotel, but the only one that had security was the BC Nurses Union.
So now you're a threat to them.
Apparently, it was rather. I was actually surprised that they went to that level. I just couldn't see what the thinking was behind that. We did manage to get past the security and raise enough of a kerfuffle that they had to come out and deal with us. And so then we were able to actually have a meeting with them. And I made sure that a photo was taken just so that we could prove that it did happen. But some of the things, there was 9 executive in the meeting and 13 of us nurses. And some of the things that we brought up were what's happening with these grievances. And there was a person who's in charge of the legal there, and she had said that she had just started the job in February. When she came on, there were thousands of these grievances that were not resolved, and she was doing her best to get them through, but it was very hard. And it was like, there's 250 employees there.
Yeah, why is
like,
how is it hard?
Why are you doing this?
Wait,
why are you doing this all by yourself?
One. So, but it's never been hard. That's the thing. These, like I was saying earlier about these unions, are very good at fighting these things, and even for people who aren't worthy of the fight, in these unions, and historically they're well known for doing this, for
Yes.
fighting and taking things beyond the pale, fighting for these employees. But this time, it's just no, nothing.
Yeah. And so then, like, we addressed the issue that our grievances in a year had not done anything. And then we also addressed a conflict of interest. So remember how I said there was a CEO that went on leave when the terminations
Yeah.
were happening?
Yeah.
They had to fill that position, and they did that in January with an interim position. And the person they hired was a lawyer who is a partner of the firm that is retained by the union for legal counsel in bargaining, which is what we're in right now. Our contract ended end of March, and we have been in bargaining. It started December, so it was delayed. We said that this was a conflict of interest, as he's in charge of the day-to-day operations of what goes on with the union, and any referral that he needs for legal advice, which is for bargaining, he benefits from it financially. And so who is he really representing? This is a conflict of interest, and we actually said in the meeting that he needed to resign. And at the very least, we asked later that there should be the documentation provided as to his contract and the hiring, because this absolutely needed to be addressed.
It reminds
During
me
the
of the
hiring
old
process.
Hair Club for Men commercials. Do you remember? And the guy who would say, "I'm not only the president, but I'm also a client." It reminds me of those. Like, that's such a conflict of interest. What are you doing? What?
Yeah.
And
And we didn't, like, they refused to answer us on that. I did actually take a complaint to the BC Law Society, and they came back with that they did not find that he was in a conflict of interest because he's not representing me as counsel. Well, yeah, he
yeah,
is.
he is. If he's doing the collective bargaining on your behalf, he's totally
Yeah,
your counsel. What?
totally. And I actually went through their own professional code, and they actually had their own example that I brought to their attention, which was, for instance, if you have on the executive of a union a lawyer who is actually retained by the union for legal purposes, this could be considered a conflict of
The
interest,
exact
because
situation was an
it was the
example.
exact
That
situation.
it's
So
textbook 101. Like, hello.
101. So I sent that back, and I said, this at least deserves an investigation,
Right.
especially since it impacts tens of thousands of people. And they wrote back and said, well, if you have a problem, take it to the ombudsperson. So I did. I did send a complaint to the ombudsperson, but I'll also let you know that last January, I submitted a 300-page document to the ombudsperson holding the health authorities accountable for our healthcare collapse, because it was them and HEABC that implemented the terminations, which now has made services to the public catastrophic and collapsing. So
Yeah.
the public is not getting the service that they deserve because of these decisions that were illegal in the collective agreement. But I'll let you know, I have not heard a word yet from the ombudsperson in 7 months over that complaint.
So here's the insanity of it, right? Like, as a person who's not part of the medical infrastructure or anything like that, when COVID knocks off, we're told there are not enough hospital beds. We didn't have enough to begin with. We need to 2 weeks to flatten the curve, and then a month, and then 2 years. But during this entire time, not only were they firing people and lowering the amount of workers, but they didn't add one hospital bed. Because that was the thing. We were told there's not enough beds. There's not enough beds. If there were enough beds, it wouldn't be an issue. You wouldn't have to lock down. But we all have to lock down because there's not enough beds. And we need to slow the transmission because everyone's gonna get it, right? That was what we were told. And then we're told, oh, once you get your vaccine, then it'll stop the transmission over, right? That didn't
Well, and
happen.
what's interesting is, I was watching BC CDC, which is the BC Center of Disease Control. So they're the ones that come up with all the statistics on what's going on.
Right.
So I was paying attention to the actual, the media like to go on and on about the number of cases, which was like who cares? That's irrelevant information. The actual hospitalizations and deaths are what we need to know. And so I was discovering that the numbers, in the 2.5 years for BC, we're running around the 4,000 mark, and the average age of death was 82 to 83. The federal government put out a document that stated that the most common comorbidity associated with COVID death was dementia. And so I knew that this was targeting people who are already in their end of life stage, which, I've worked enough to know that we're not going to stop that process. People, if they're at the end of their life, they are going to die. And I knew that the BC CDC also put on their site that if you had a positive COVID swab and you died within 30 days, you were counted as a COVID death, no matter what you died from. So if you were dying in a car accident, or you had terminal cancer or heart attack, you were still put in as a COVID death statistic, even though that's not what you died from. So I knew that they were playing these numbers. I also knew that there was like 25% more overdose deaths occurring in the same time frame. And this was not even being acknowledged at all. And in fact, now our provincial government is making these drugs that have been killing people legal for you to have. So, the discrepancy between what really is the health crisis and the mechanisms that we're using to address it is just, there's no rational sense there. And, in our community, I know that, in the 2 years of COVID in this community, there was one death that the funeral home took care of, that was a 94-year-old person. And then the overdose deaths were coming in weekly. So it was just like, knowing what was actually going on in the front lines was very concerning to me, that the government was just blatantly lying to people as to what the real emergency was.
Right.
So
that's all we got. We got in the news every day what the numbers were.
Yeah.
We got this many cases, this many cases. They had tickers. You could go on the internet and you could look at the tickers, how many cases are coming in, where they're coming from, what regions. What other, because you've been in healthcare, and what other sort of ailments did they ever do this for? Flu season comes every year. Do they come in and tell you what numbers of cases are coming in? Or are they coming and...
No, because the reality of influenza, and especially even with those vaccines, they're reading that from different strains that occur in the East first, and then they have to make a guess. So we anticipate in 6 months, when it moves to the West, these are the ones that we are going to have to make a vaccination for. And usually they're looking at 20 different strains, and they can only pick 3 for those influenza vaccines. And like many times, they never even got the right one. So you're getting this vaccine for something that it's not even going to hit the strain that's out there.
And why is it that people don't get it? Like, why is it people like...
Because they're lied to. This is
no, I mean, they don't get the flu. Like, I like, for so many years and years and years,
yeah.
I never got the flu. Like, I've had other things that are common things, the one that they always say, the 24-hour flu, but it's just food poisoning of some sort or another, right? Like, okay, yeah, all right, I had Taco Bell. Sorry, Taco Bell. It's not the most well-known place for not getting stuff, but like, it's one of those things. People every year don't get it at all. It's not like, I know it's a respiratory ailment, and it's something that passes on, and it's very easy to transmit it to person, but there's year after year, or like, I just don't get it. Is it a lack of being exposed to it, or is it just some people just don't get it, or don't show signs?
It really comes down to, your body is made to come up with natural immunity. That's its natural function. And this process of the pharmaceutical industry determining that, oh, we're going to mount that response for you because we make money off of it, is becoming problematic. That industry has become massive in terms of even what they're giving to children right now. And I mean, the good thing about this is, I had 4 kids. All of us did our vaccinations. I had to do vaccinations for nursing school to get them upgraded. And now all this has done is created suspicion on
Yeah.
that whole industry. And actually, that to me is a positive thing, because the more that I've been looking into this, there are some significant warning flags. And so everybody should really do their own homework on that.
I've
But
been so
I'm
careful
not,
for so many years. I'm not some
yeah,
health nut. I'm not I'm not a buff dude or any of that stuff, right? I get a
yeah,
regular amount of exercise. I try to stay healthy as much as I possibly can. But what I try to do is avoid medication at
yes,
best, right? I don't overtake, ibuprofens or acetylsalic acid or Tylenol, things like that. If I don't have to, right? If I have a headache, sometimes I just need more water. I'll try that first before I go right for the pills, right? And painkillers I've been especially afraid of, because I've done sports and stuff. You get an injury and then they're like, here's some T3s. No thanks. I'll try to avoid the opiates, because I just know how I used to be a smoker and an addictive personality. So I'm just like, I'm going to stay away from that, like way away from that, because I know the dangers of it. And a lot of people get caught in this trap. I was on a bus once, right? I was living in Sudbury, Ontario when I was younger. And I was taking a bus down to Toronto for whatever. I was going to meet some friends. And it was pretty a pretty slim Greyhound. Believe me, there's like 5 people in the whole thing. Going from Sudbury to Toronto is not. I don't know. I know Greyhound doesn't exist anymore, but that used to be a thing. And the Greyhound buses. Anyway, I'm going too long with the story. I was on the bus and I met this guy on there, and it was like a 4 or 5 hour drive, so I wanted somebody to talk to. It was before the time of cell phones and all that stuff, so I get yakking with this guy, and I'm like, "So what are you going down to Toronto for?" He says, "I'm going to get my methadone." I'm like, "What? You don't look like a heroin addict." And he says, "Yeah, I know. It's crazy, right? Here I am. Every weekend I got to go down to Toronto from Sudbury, Ontario, to get methadone, because they won't give me too much because they're afraid I'll take it all. And I probably
right.
would." He's like, "I probably would." But here's the thing. It all started because I got a sore back. I got a sore back at
Mhm.
work. And they gave me T3s, and eventually I won't do it. And then they give him something else, oxycodone or whatever. That won't do it. Give me more. I need more. And then he can't fill his prescription. And then he's buying oxy on the street. And he's got his prescription and the oxy from the street. And then, oxy goes dry on the street. And somebody's like, "I got something that'll work for you." And the next thing you know, he's hooked on heroin.
Mhm.
And I thought that was absurd at the time. I was like, no way. Like, this can't be a normal thing. It turns out it's actually very normal.
Well, I mean, I think all we have to do is go down to Eastside Vancouver to see what's going on with what's happened to our society. And I find it interesting that our government is willing to legalize drugs, but they sure aren't willing to fund more rehab beds. And I know in our community we've lost a lot of young people, and it's devastating. It's devastating to a community when young adults leave because of that. It's just it's just so pointless. And there's lots of this harm reduction talk, that, well, if we just had more safe testing, but it's actually, the problem has just exploded because of access to these drugs. And yet I don't see any kind of response from our government in terms of toning that down. So I'm seeing an inconsistency in putting all of this pressure on society about a respiratory illness that 99.7% of the population can recover from easily. But the things that are actually killing us, that goes unnoticed. And I'll kind of go back to, you had mentioned Bill 36, and that was passed. This was passed in the BC legislature in November 24th of last year. And when this bill passed, then I started to understand, oh, okay, this is where we're starting to, now I know why this has all happened the way it did. So Bill 36 is a new Healthcare and Professions Act that Adrian Dix introduced into the legislature. It is one of the largest bills ever that have been introduced. And so a bill is in its first stage is called a bill, and there is discussion that is supposed to occur with all of the members of legislature. They have 3 readings. And so if there's any adjustments or amendments that have to be made, or if there's confusion or clarification, they have time to discuss it and then make those changes before it's actually voted on and then implemented into law. So Adrian Dix had then, they said, oh, we consulted with healthcare professionals. They said there was 5,000 of them that they consulted with, and everybody was in agreement with this bill, except none of them really knew what was in the bill until it came out. And so what this bill has now introduced is, currently, remember I was talking about those licensing bodies where we have to pay so that we can practice. Up until this point, each one of us had our own. So the nurses have theirs, the doctors have theirs, dentists have theirs, and they vote on a board of directors to govern this licensing body, because this body really determines what's called your standards of practice. So that's the requirements that you have to operate by when you are providing healthcare. And so
this has to do with ethics and a bunch of other stuff, right?
It does. It has to do with ethics, but also practical applications. Like, in my case, I also did nursing up in a First Nations community. And up there, because there's no doctors, you have what's called a bigger expanded practice. So I'm able to do things there that I'm not able to do in my home community. Oh, okay. And so some of those would be, if there was, ear infections at a certain level, I could dispense and give medication for that according to what's in their called their decision-making tools. So they give guidelines of practical things that if you need help with how to what medications to give or how to do certain tasks, they'll provide direction on that.
Is that just because it's remote? So like it's easier to have a protocol than to call in a doctor for every specific thing, like you just don't have the access?
Well, I certainly find it interesting because actually as a nurse, I have a scope that I can operate with. It's the health authorities that limit me.
Right.
So for instance, I have the ability, I could do PAPs, but the health authorities say I can't. So that has to be a doctor's role. So this whole shift of function and responsibility, a lot of that, the system is inefficient because of how the health authorities administer it. It's not to do with what I'm actually qualified to do. So then with these licensing bodies, there's always, in my case, there's nurses on the board. Now, one of the first things Adrian Dix is going to do is take out all of those elected board of directors. He's going to amalgamate those colleges down. So there's currently 16. He's going to put them into a group, six groups. The government is going to appoint a panel of directors on each of these licensing bodies. And it is this panel that is going to determine the standards that have to be practiced by. And he has already said that he's not going to guarantee that anyone from your profession will actually be on that board. And there's 2 reasons for this. He wants to standardize discipline. And he also wants to make it easier for the public to identify where they need to go if they have a complaint. But I mean, one of these groups, he's putting
It's
opticians and
interesting that those are
psychologists.
the two big priorities, right? Standardizing
Yeah.
discipline and giving a place for people to have grievances.
Well, for people to put in complaints, because that's
Yeah.
basically also the function of a licensing body, is if the public has complaints, then they're supposed to
But
deal with
again, they're
it.
putting together another body of bureaucrats that have no idea
Yes.
about maybe they do, maybe they don't. We don't know.
We don't know, because he said that he's not going to necessarily guarantee that anybody from your profession will be on that panel. And he's putting one group has opticians and psychologists together. So I really don't see the common factors of how an optician and a psychologist would practice. So that, again, that's another thing that doesn't make sense. But also what they're implementing is they're going to put in all the guidelines for you to have a license. And in that, they did introduce that mandatory vaccinations will be now part of your licensing requirements, which is not going to be now related to your employment qualifications.
Right. So that's
So
a huge change. So
this is huge.
that limits the grievances that any nurses could have at this point. So nurses, you wouldn't be able to take it up with your union because you've lost your license. You can't even be employed with the union at that point.
Well, and this is the issue. So if it's an employment related issue, which is what my current grievance is, my employer made a decision that was against the collective agreement and was against the policy. And so now my union has to go and fight for me. If this now gets downloaded,
which they said they won't. Essentially, they said they won't.
If this gets downloaded to the licensing bodies now, then it becomes that it's no longer an employment issue, which means the unions are no longer responsible. They can wash their hands, but now you won't be able to practice because you can't get a license. So right now, currently, there has been a flurry of activity from healthcare workers who are feeling very concerned about this. And there is lots of license applications going on in other provinces. Now, for instance, now, I don't know if people are aware, but last July, Alberta Health rescinded their mandatory vaccination policy. And currently, the only other province that is enforcing it is Nova Scotia. Every other province, Ontario, they've downloaded it to the employer, but it's not provincial. But us in Nova Scotia are the only provinces that are still carrying out these mandates. And so our nurses are
every
now,
time I bring one of these
nurses,
every time I bring one of these stories, all my friends say, Alberta's calling, Clyde. Alberta's calling. Yeah. So many people from Joe's laughing. Clyde. Joe's laughing
Alberta's
right now.
Calling.
Yeah, he's in Alberta, right? So he would like me.
So many of our nurses are working just right across the border, and it's like this is an invisible line.
But here's the thing. Here's the thing. We have the NDP in British Columbia that is putting this all in line. Now, the NDP in their constitution as a party, they have to listen to the bigwig. They're a hierarchy, and if you read their constitution, it doesn't matter if they're provincial or federal. They have to listen to the leader of the party. This is how their system works. It's not like the other parties where it's kind of like there's a federal and a provincial version of the parties. No. Jagmeet Singh is the leader of the NDP, and he's calling the shots for David Eby, for Rachel Notley, for all of them, right? And right now, there's a lot of people that are waiting. They're sitting there with boxes packed, waiting to see what happens in that election in Alberta that's coming up, because we don't know. Do you think you want to be there if they're going to have the same stuff going on in British Columbia happening in Alberta in the future? I mean, we're the test case right now for this bill 36. All of this stuff that you're talking about. This isn't like one province, they'll do it that way, they're going to do their way, and everybody else. No, we're a test case, in my opinion, anyway. I think that's
well, and then that whole Bill 36, they actually went to discussion in legislature, And there's over 640 clauses in that, and they only got to 220. So you remember how I was saying that there's supposed to be discussion and amendments occur before it's moved
Debate.
through the law.
People
They didn't even get through the first reading, a third of it. They didn't even get through. And there were some considerable concerns that were brought up. I actually, if you can believe it, I started watching legislature live to see.
Thrilling, right? This is thrilling.
Doing.
I'm always waiting in these debates for them to just say like, "Why are you bringing it up? We talked about it at the cottage last week, right?" This is. It all feels like an inside deal to me. Like, why would you have this big stack of paper hits the desk and you're just like, "Yeah, I'm cool. I'm just where do I sign? Where do I say yay?" You know?
Well, and that's what the NDP government did, is they got to 220 and then they forced a vote, and all of their side voted it through. And there were concerns because it now has increased the ability for the government. There's a thing called like misinformation. So if you, Adrian Dix actually said this in person, if you are a healthcare professional and you are communicating information to the public that is not aligning with the government is saying, you will then be termed that this is misleading information, and there is a duty to report you because you will be deemed to be unfit for practice. And then the penalties for that are up to 6 months in jail and $200,000 in fines. And if they are going to investigate you, jail. If they're going to investigate you, they've given themselves power that they can go into your premises without a warrant and confiscate your assets, which does include patient medical records as well.
Wait, in your premises, your practice. So like
yes.
They can go.
So then even the public's private medical records are no longer protected anymore. There are significant issues in this bill, and Shirley Bond and Mr. Lee, they were the two active ones that were sort of really trying to nail down clarification, because they were like, this language is very ambiguous and vague. And Adrian Dix's reply was, well, it may be hard to understand, but it's English. And that's all that's required.
It's
to
English.
Let people know about what he's trying to pass.
Right. This is so many things come up in my mind, right? Of how this could be an issue for people, just everyday average people. Here's the thing: you're a law-abiding citizen your whole life until you do something wrong and they're trying to get you, right? This is kind of what we're learning now. This is Canada. This is what we used to refer to as the Soviet Union. But these are the practices now. If you do something wrong and they want to get you on something, it's the show me the man, I'll show you the crime. This is the way they go about it. And what if you go to the shrink? What if you go to a psychologist, psychiatrist, or whatever, and you're sharing information with them, and you lose doctor-patient confidentiality because of the way they're operating here. And then your doctor, they want to get a patient of a doctor, they could just go after the doctor on some thing that they can come up with and go seize his records.
Yeah. Well, and the language is concerning, because he actually introduced the whole thing of if you're a health hazard, you can't practice. Now, okay, I get
what does that mean, though?
Are...
That could be like they could make up any reason why you're a health hazard.
Well, I mean, I can see if you're a drug addict and you are in withdrawal and you're a surgeon and you're handshaking. Okay, that's a health hazard. But also, our government has stated very publicly that anyone who is not vaccinated is a health hazard.
Yeah, they've said that.
So now,
which is false. It's false, though. But it's and I can say this in the terms of service, whatever. Someone who's not up to date on their vaccines or hasn't had it's false. They're not a health hazard for other people. It's not dangerous to be around other people. Like that's sick.
I gotta tell you something. So this just happened this week. So one of my nurses actually emailed the Ministry of, or sent a letter to the Ministry of Health and said, okay, I'm not understanding. So you're not allowing unvaccinated to work, but you are also saying that your workers have to be up to date. But your workers, you haven't made mandatory boosters, which would make you up to date. So
Yeah.
I'm finding this confusing because you're saying that your employees are up to date when if they haven't had a booster, they're the same as an unvaccinated person.
Mm-hmm.
So then they responded back. And so then they gave her a phone number to call. So she actually spoke to a Ministry of Health supervisor. And she gave me a copy of the recording. So I have it. It's golden. So then she brings up like Bill 36. And she's like, well, I'm curious as to what's the plan with Bill 36. And the Ministry of Health supervisor said to her, oh, that's a federal issue. That has nothing to do with us.
No, it's a provincial bill.
Yeah. Yeah. This is a BC Ministry of Health supervisor who said that the Bill 36 was a federal initiative and that's not something that they have to deal with.
So
okay?
I've been talking to people that have colleagues or know people that are doctors, and I talked to Dr. Brian Day, and I talked to a bunch of other doctors about Bill 36, and the consensus around the industry is nobody knew about it.
Mm-hmm.
Nobody even knew about it. They're all too busy. They got other stuff going on. They just kind of fell on their
Nobody
laps.
was informed in frontline healthcare. And what I also discovered in going through the BC legislature site was I was unaware that back last spring, they actually passed Bill 4, which is a Skilled Trades BC Act. And the same thing happened
you're
to
a skilled
them.
trades. Hold up.
Yeah.
Tell me. Because I'm part of this. I'm part of this.
So they're
I'm a mechanic.
they're removing your elected board of directors and appointing their own panel members to oversee all the trades as well.
In British Columbia?
In British Columbia.
But I'm under the ITA, which is the Industry Training Authority, which is Canada-wide now.
Bill 4, check it out.
I gotta do some research.
It's all I can see is the government is trying to infiltrate every governing body over every worker in this province, because that government is setting itself up to totally dictate what conditions are in place in order for you to practice at your trade or your profession.
Well, this was the big fear that I had, right? Because not only is it because of the vaccine thing and they're mandating vaccines for people in whatever industry, but also the Jordan Peterson situation. Have you heard of what's happening with Jordan?
Yeah.
So Dr. Jordan Peterson, for anyone who's listening and don't know the situation, has been an outspoken political figure and an intellectual for many people, wrote several books, and he's a clinical psychologist, and his license is in Ontario at the College of Clinical Psychologists. Now, some people, anonymous people, filed some complaints through the board for the board of directors at the College of Clinical Psychologists in Ontario, and they basically called him in to do re-education training on how to conduct himself on social media in public, or he'll have his license pulled. And this is like it's 1984 world we're living in here in Canada, where the colleges are doing this. And not only that, it's ridiculous because it's he has to pay for this re-education if he was to go along with it. He has to pay for it at some exorbitant price. Whatever, psychologists make a decent amount of money. It's less about the money, but it's the insult to injury. And not only that, he'll go through this whole thing, and when he's learning that 2 + 2 is 5 instead of 4, like in the 1984, the book, if they don't feel he has the right conviction, and if he's just saying what needs to be said to go through, they'll take his license anyway.
Mm-hmm.
This is unreal. And one thing that I said in one of the videos that I made talking about this was that I'm under a training authority. We all have authorities over us if we have any sort of skill or any sort of thing where you need credentials for your job. You don't just go to university and then I'm going to go get a job. No, you get some sort of credentials. And there are these training authorities, there are these colleges, and if they're weaponized with this politicization, they could come after all of us. So if I don't speak out about Jordan Peterson's situation, what's next? The ITA, the Industry Training Authority, which is Canada-wide. It's now you're talking about a provincial version that I didn't even know about and I got to look into. But this is terrifying, right? It's terrifying.
Well, it's now become up to us to protect ourselves. And, I was leaning on the thing that, somebody's going to come and rescue me. And I finally discovered that actually nobody's coming to rescue us. And you and I are the solution to this problem. And so, this last year for me was this uncovering of all of the elements that we know to be true. We have been told over and over that actually, no, the story is something different, and we're coerced into believing something that has no substance to it, and it has made people feel very. It created fractures in our society that were really brought to the surface. Like we didn't. It's like, okay, I like to give this example because it's a historical thing in my family. So I'm married to a Japanese man. My husband's family were second generation Canadians, and they were in Vancouver. And during the Second World War, the BC government decided that they were a health hazard, that they were a danger to society.
Yeah.
And so all the Japanese had all their assets confiscated.
Is that the justification that they use? Because we all know that they put them into camps because of the war.
Yeah.
And because of the allyship with Germany and all that stuff. But like sorry to cut you off, but they actually used health as the justification for it.
Well, they said that they were a danger to them. And so then, in fact, what they did is they put them all in the PNE camp, and then TB went rampant, and thousands of them died from TB. The rest were put into internment camps up in the Kootenays here, and then when the war was over, they were all told they had to move on. They couldn't stay, so they had nothing. Everything was taken, and when I met my husband and we got engaged, I actually said to my father-in-law, does it bother you that your only son is marrying a white person? And he said to me, no, the more mixed up everybody gets, the less prejudice there will be. That still makes me emotional.
It's powerful.
Because over the last couple of decades, we've actually seen that. Like I had kids, my kids are interracial.
I saw pictures of you. I saw a picture with you and your children. They're beautiful. They're beautiful. Yeah.
And our country is, we're embracing all sorts of different cultures, and there's lots of intermarriage. And so now the race thing is not such a significant thing. But so instead, the government decides it's going to create something invisible now to create division. And what I discovered was that we as a society, we actually didn't learn anything from our history. And it looks like every single generation is going to have to figure this stuff out. And we actually had an event in that occurred in our society where we had to figure out how we would respond. And the amount of discrimination that occurred, I was actually shocked by. My family members go up to the ski hill, they bought a season's pass. They're not even allowed to use the same toilet as the vaccinated. And I was like, how did we deteriorate to this? I thought as humans, we had evolved past this, and it didn't happen. And instead, families themselves allowed conflict and division to occur, and there's many that have still not repaired that. And all I'm going to say is, if that continues, we have failed as humans, and we need to start taking responsibility for that. That is no longer something that we can allow to be normalized. It is behavior that is not what we should be exhibiting, and we need to clean that up. So that was part of, you know, my process in moving through this whole experience, where, you know, first I'm finding out that my employer is making decisions that are irrational. Then my union is making decisions that are unethical. And then I'm moving into the law society, who won't enforce their own professional conduct. You know, I'm moving into now things that are occurring in our government, where our prime minister is willing to give $1 billion to Ukraine for missiles to help their war, but he won't help with healthcare. He's like the husband who borrows all this money that he can't pay back, and he's paying off his mistress while his wife and kids are starving. And then at the same time, he's trying to take away the firearms from Canadians. Why is he so hell-bent on taking away any way that we can actually survive on our own? These are things that are we have moved into a state of oppression. And all you have to do is look at your gas bill. I mean, I got my house heating bill this month. The gas itself was $226, but the bill was $700 by the time you add in all the carbon tax and this tax. And you know, interest rates are going through the roof because of their undisciplined spending. And so now we're entering a phase where the average person is not going to be able to survive on their income, because every time we turn around, our government is taking more taxes. So, you know, part of my process was when I finally realized that all of these systems that are in place to protect us are not functioning. What do we do with that?
What good are they? What good are they? That's the real question. Why do we have them?
Why do we have them? And it's like, do we even want to even protect them? But I realized, is the goal to take out our union? Well, if we don't have a union, then what mechanism do you have to actually rally large groups of people together in order to make some kind of reaction to the government? What other mechanisms do we have to hold our government accountable? And I realized, like, even though unions are neutered, we still need that ability to get people together in a mass and create some kind of action that would put pressure on the government. But even at that, we're going to have to break the law to do that. Like, I don't think people are aware of all the rules involved in allowing a strike. You can only do a strike when you're in bargaining. So in our case, you know, those two parties have just started bargaining December. They're doing it right now. This is the only time frame that we could actually call a strike. But then, in order to do that, you have to come to an impasse. That means you cannot agree, and so as a result, you're stuck. You can't get any farther. Then our side has to ask the other side, "Can we strike?" And they can say no. And if they do say yes, then you have to take it to a vote first. So the steps involved in actually getting to a strike,
neutered.
and
that sounds neutered.
Yeah, and because we're essential services, the government can legislate us back. So say we're on strike for 3 days. Okay, strike's over. Get back to work, folks. And there's nothing anybody can do. So you tell me,
what about a walkout? What about like the actual people of these organizations just getting together outside of their union, just saying, we're all walking off. We're out.
That is the only way it would work. And for that to happen, it would have to be illegal. And for that, people would have to understand really that their union
it's illegal. Bye, walking out. You know,
but people are still under the illusion that the union actually will take care of things. They don't understand that there is actually no power behind those doors, and the only thing the union is doing is providing high-paying jobs for people who are employed by the union.
I don't see a way around it, except unless you worked for a smaller organization. if there was an ability to work for a smaller organization. Because I know within small organizations, your being there or not being there is a huge impact. So if you just say, well, I'm not having this because we can't come to an agreement, I'm out. That's night and day in a small organization. If you're a big conglomerate, a big situation, you're just a drop in the pond. Okay, well, we'll just call somebody in to cover your shift. You know?
So the only issue with, I'm going to just use nursing as the example, is that if we don't show up, people die.
Yeah.
And so the pressure on nurses, and the fact that a lot of, not all, but a lot are in this career because they do have some kind of ethical, I don't know, moral code that they want to contribute. They don't have that internal mechanism that would allow them to walk away if that meant that somebody suffered and died because of it.
Mm.
And they use that. The other side uses that
Well, it's just like the
against us.
teachers. The teachers, think of the children. Think of the children.
Yeah,
You want them to get back to school, right? Well, you're holding children hostage when you go on strike. Like, that's what you're doing. People are using school as a daycare, essentially. It's like, so they can go to their job, and you take the kids out of school, you're holding their job hostage. It's like either they have
yeah.
to pay for daycare or they have to take the day off work. And it's like, I've always seen it as blackmail. Like, I've always seen this kind of situation as a type of blackmail, and you're not affecting the person that you're actually negotiating with. You're affecting some other third parties. Now, we had a bus strike in my town just last year, and it went on for way too long. And I'm talking about the municipal buses that go around and collect people. And we're kind of rural town. There's not a lot of people take the bus anyway. You live here, you got to have a car. It's just the way it is, or ride your bike or whatever you got to do. But anyway, they went on strike, and it was embarrassing. It was embarrassing how long it went on for. And then when they finally reached a deal, the town decided that for a year they're going to make bus fare free. Like, they took a hit. But who takes the hit, really? Taxpayer. So buses were free for a whole year in the town. And I thought it was ridiculous. And I was talking about it with some people, and they said, hey, did you know in Japan they had a similar situation where the bus drivers, they went on strike, and they just weren't having it. They wanted a better wages, they wanted better conditions, a bunch of stuff. So what they did was they just put a note over top of where you collect money and didn't allow anyone to take any fares in any of the buses. But they kept going, and they took people where they wanted to go, so they didn't inconvenience the people that were the customer of the situation. So they found an innovative new way of doing it. And basically what they did was they took money collection they put money collection, part of their job, on strike. And boy, did they work out a deal fast.
Mm-hmm.
That's the way to do it. It's finding new innovative ways. And I'm not saying that this is how you could do it, because there's no money collection in the hospitals, but sometimes it takes a bit of innovation to get people's attention. But I mean, obviously the cards are stacked, right?
Well, it does, but I think the biggest challenge, which is why I'm so thankful for you, is that the media propaganda has contributed significantly to the instability of what's going on in our province. So, I mean, even within nurses, I mean, like I said, there were, at least 50% that, walked into this because they were coerced. But we also had quite a few vocal ones that were saying that we deserve to be fired. And because the truth is not being put out to the public in a way that is accurate or actually provides the true story around what's going on. And so, it's funny because I was talking to a retired attorney general, I don't know, last week. And I'm like, there's got to be some kind of legal mechanism that we can hold the government accountable on this issue. And she said, the only thing you have is to sway political opinion. And I thought, since when did our enforcement of our rights and our protections depend on public opinion, especially when maybe they're not even educated or given the opportunity to know what the facts are, because we know how much stuff has been censored. So we're fighting this whole information access. Like, nobody can make a good decision if you're not being told all the facts. So how do we mount a response to anything? And this is actually what I see is part of this plan in destabilizing, because I actually think the long-term plan is, well, I forgot one part of the story.
Okay.
You know, the guy that I had a conflict of interest with and put in a complaint to the Law Society. In that in-person meeting, we said to the executive, from our information, we can see that none of you actually know what's going on with the government. And the only person speaking to the government is this lawyer. And he is not passing on any of those discussions to this union. And the lawyer said, well, that's because if I disclosed our conversations, they wouldn't tell me the stuff that they tell me. He admitted that. And so here we have one person in this whole union who is having discussions with the government in terms of the terminated. And we're told, oh, you know, he's bringing us up at every meeting, but there's no proof of that. But so what we have is one of our executive of our union who's in private discussions with the government, who now is implementing the process of bringing in foreign workers. That's how they're going to deal with this issue, which they're also speeding up the assessment process on them. So they're not going to look into their background as thoroughly as what they usually would. And so now the public needs to understand that the training that we get as Canadians is very different than what other countries provide.
Yeah.
And even terminology for medications is different. So now they want to instead bring in all of these foreign workers. And at the same time, the government is going on about how we're in this huge housing crisis. And so what's the plan for where they're going to house all these foreign workers to replace the people that are already living here that are able to do those jobs? It gets to the point where you just think, the system is broken. But actually what I decided was, no, the system is not broken. All of those mechanisms are just and right in how they are, how they're supposed to work. We have a human rights tribunal. Your Medicare Act says that you have the right to personal choice and autonomy in your medical decisions. Like, all of these are actually your right. It's just nobody's enforcing it. We need to actually go through and pick out those people that are causing the corruption. And we all know who they are. How do we start picking them off? And I realize now that the only solution I can seek, because you already brought this up, like what can we do except move to Alberta? the only thing I can see is
every time Joe's laughing, Joe's just laughing every time.
We are going to have to move out of places of leadership, these people that we know are corrupted. I don't know how we're going to do that.
So I had an idea.
Yes.
I had an idea. And this one kind of hits on both things. So you mentioned that you have to play the political game, right? When you're doing this. But what do people actually want to do? I put this out on Twitter a little while ago, and I said, so nurses, doctors, practitioners are out of work. We have people who want to have services performed by doctors, nurses, practitioners. It sounds like we just have a logistics problem at this point. And then, so what crossed my mind was hospitals, for a historic portion of our known history, were run by churches. And as far as I'm aware, there's nothing stopping people from helping each other out at a religious institute. Like, so if you happen to be on a church premise and somebody comes in and they need help and you just happen to be of particular know-how and you can help people out, things can happen. And it's actually well known that a lot of throughout the centuries that, you know, the downtrodden were taken care of in church buildings. And I was wondering if a lot of these fired nurses, practitioners, physicians got together with religious institutions to open up triages or places where people who are being denied services, a place to go in and meet with people, and then have, you know, it doesn't have to be, you know, like a salaried pay or anything. I mean, that could be worked out with the religious institution, but this would be a charity of sorts. And, you know, people who work within a charity get paid within a charitable organization. And this is all legal. This is all things that can be done. But if all of the people that have been ostracized and kicked out of society and told that they can't operate started operating within an old institution rather than within a new institution, if the government were to step in place, that would be the ultimate damning position for them to come in and go after the churches.
But they have, and that was in the Bill 36, that anybody who tries to practice as a healthcare professional without a license is going to be subject to jail and fines.
Even in a religious institution.
Yes.
Don't call it healthcare. Call it.
Well, we are exploring other mechanisms. So things called a private membership association, where people actually have to buy memberships into this association, which would give you access to a consultant. So, you know, we're even having to look at the terminology that can be used.
Yeah, you could be a consultant. The reason why I say the churches, because I know the churches are always looking to help people, right? And this is the way it is. Whether you want to be a religious person or not, the churches always have open arms. Like, this is just the way they are. And what would be egregious for the government to do is to step inside a church and try to police what goes on within those four walls. And I know they've tried during the pandemic, but there hasn't been like a gross number of people that are seeking treatment and finding a way around the awful medical system that's plagued us, and then have the government step that one extra step into that new boundary, I think would damn them completely and could kick off the political well for people to just say enough is enough. This is over.
Yeah, the issue is as well, you're a mechanic and you know that in order for you to do your job, you need your tools and you need your parts, right? And healthcare, we are very dependent on equipment and medications, all of which are very expensive. So the actual ability to acquire those tools of the trade would be very difficult, because we're not a population that can finance that. I've gone through all sorts of kinds, realities of how do we approach this, because it's totally accurate that the ability for us to be able to access healthcare is it is collapsing. It will get significantly worse than what it is now.
Yeah.
And people are not going to be able to get treated. People are working on this. We're trying to come up with solutions. And I know that because we are, this population that was willing to actually step away from their careers and their security to make this stand, I think the population should, if you can't support our reasoning behind it, you should at least be thankful that there's somebody out there who is willing to make the sacrifice to hold our government accountable. And how can that hurt you as the public, to have people trying to demand transparency and have accountability in the decisions? This can only be beneficial to the population. So I'm just going to say, stop being so critical of us. We paid a cost for this, and it's actually for everyone's benefit. The fact that we're speaking up is, it just shows that some of our democracy is still functioning. But there are significant challenges that we haven't fixed yet.
Well, if it was just a funding challenge, I mean, I would lend my platform to tell people where they could, because so many people online are so generous.
No, I'm talking, ECG machines, medications, IV supplies, just
you
basic
wouldn't believe how resourceful the internet is. When you get these,
well, I guess.
Yeah, when you get these ideas out there, people are very resourceful. And
yes,
I mean, I can't, I'm not saying I would run it or anything like that, but I would get the word out, and I would help encourage people. Hey, go over here. This is where you could donate. This is where you could give information. This is where you can, bring things forward and get the ball moving. Because there is so much that people are willing to do, and you'd be surprised. You'd be surprised. Absolutely, the people are really on board with this.
I do find it pretty incredible the organization and networking that's occurred in the last year. With not just doctors and physicians, but communications, legal, different financial things, like the people that have risen to the surface across our country have organized well, and they are intelligent, resourceful people. So I think if there is going to be an actual ability to create something new, or at least build something that's going to work for us, we do have those people that are in reach. So that gives me optimism. I'm not convinced that we're going to be able to pull this off. It may be that this is going to be the end, and it's just the way it is going to go. But if we do have a chance to rebuild, because this is kind of what I look at. In the last few decades, our society's had life pretty good. I know that I've just been focused on working and seeing if I can go on a vacation somewhere. So I wasn't paying attention. But then we ended up getting that the whole spiritual component of our humanness started to deteriorate. And what I mean by the spiritual component is the things that guides us in making good decisions. What's wisdom? How do we apply critical thinking? How do we know that the decisions that we're making are actually beneficial to us? How do we receive input? All of those components we really haven't put a lot of emphasis on. And this last year drove a lot of us to the wall in terms of, what do I really believe? What am I willing to pay for that belief? Am I committed to, and for me, I had to face, do I want to move to Mexico, or do I want to stay and fight this? And oh my goodness, my battery is going. I'm going to move downstairs.
Okay, we're going for a ride, everyone. We're going for a ride.
So this pressing into what is our moral, ethical depth that will be able to give us guidance on how we are going to rebuild how we want to live. And sorry, guys.
No, it's fine.
You're okay?
No, we're good. We're good.
All the plugins are out, and
did you want to have a minute to set up again with your plug?
I'm all plugged in, but nothing is showing. Oh, okay, yeah, I'm good. Let me just move my
Well, we could take a quick break because I have to use the washroom, and then I'll edit this so you can figure out your lighting. We'll just keep the thing running, and then I'll just do a quick. We're back. Okay, we're good. We got that opportunity to get everything squared away. But yeah, we were in the process of talking about, I guess, parallel societies. We're talking about societies sort of, it's run amok, but and we all want to get on with our lives. We really want to get on with our lives. We've got all this bureaucracy, big government stepping in on everybody's toes and just ruining every industry there is out there to work in or be a part of. And now we're at a precipice where it's like, do we abandon where we're from, or do we just rebuild despite them still existing? Do we just have new industries that we just circumvent the rules, I guess? And Canadians are resourceful, I find. They're very clever of just getting around stuff that the government puts in the way. Is this something where we'll have to do?
I would say that that is a characteristic that is for sure exhibited in part of our population. The ability to critically think, to know how to survive, to know how to create structures and networks with other people that create benefit for your community.
Mm-hmm.
I'm not convinced that every area in BC will be able to survive this. I think the cities are showing that domination is their choice versus being autonomous and free. I
That's
really
fine.
believe
They can take that and they can lose all the skilled people. You know what I mean? It's like clamp down and have your cars that don't get fixed and have your stuff. I mean, here's a funny story, right? So a guy I work with, colleague, he's a service writer. He went on a trip to Hawaii, and his partner is from Hawaii, and she grew up there, and now they live here. And I asked him, I'm like, how was the trip? He's like, it was good. It was like kind of a staycation sort of feel. I said, I'm always afraid of going to Hawaii. I've never been there. I might never leave. Right? Like, I'm gonna look for a job. I hear it's beautiful, right? And he says, it's beautiful. It is, but it's hard because the healthcare is crap and it's expensive to live there. I said, yeah, enough about here, but what about Hawaii? And he's like, oh yeah, good point. Well taken. Fair enough. But yeah, I mean, this is the situation we found ourselves in. Housing's too expensive, and there's no room for the people that need to actually run the society. We're all being kicked to the curb.
You know, I'll tell you one story that I heard one of the MLAs talking about in the legislature, you know, that fun Friday night when I was just watching the live show.
Yeah, it's the most entertaining. Get your popcorn, right?
So I wasn't aware of this, but there are certain areas of the province that if you don't live in your home all year round, you are taxed extra, some kind of luxury tax. Are you aware of this?
It's a new one, yeah. That's a new one.
So this MLA was talking about one of his constituents that came to him and said, look, like we're retired. We don't want to winter here. We go down south for the winter months, but because we're not in our condo the whole year round, we have to pay this luxury tax because somehow that's going to create more housing. Okay. So then one year they decided, okay, fine, we're just going to rent out while we're gone so that we don't have to pay this tax. So they rented out their place, except the government forgets that they made illegal term leases. And when they came back, now this guy has the same rights as any other residential tenancy act person.
And they don't have a house.
They couldn't get him out. And so now they had to go find somewhere else to live, and this guy stopped paying the rent. And so they have to pay for both places because the government keeps making all of these taxes and infiltrating these rules. And this is what oppression is. It is actually making it impossible for people to enjoy their lives, to use what they have accumulated for assets to their benefit. The government tells them how they're allowed to use it. And this kind of domination is seeping in, and it is becoming normalized to us. It's normal that you can't find a doctor. It's normal that you should have to wait 12 hours in an emergency to be seen. It's normal that that the government can put on more carbon tax, even though their solutions are ridiculous. Like, the oppression is becoming normal for us. And that's what I find concerning, that we have lost our ability to recognize that there is abuse going on, and that the only way that abuse will stop is to take out the abuser. Now, every community is going to have to figure out who they want as their MLA. And, part of my thinking process as I was deciding if I had to, move to Mexico or stay here, was that if I am going to stay here, I have to acknowledge that this is a long-term solution. We're not going to fix this year. And in fact, I am expecting that things will get worse. But the long-term strategy is we have to start choosing people that we recognize within our own communities as being ethical leaders. And once we decide who those people are, we need to get them voted in, and then we need to support them, because the first thing that happens to people when they take on a leadership position is they get crucified. We have to stop this kind of mentality. We need to recognize those that we choose. When we get them in there, we need to support them and help them in that role. And then we need to find better ways of, within our own local communities, setting up wise councils that can actually input into the decisions that are being made. Currently in my riding, which is NDP Brittany Anderson, I don't see representation of people. I see voting along with whatever the party tells her.
Mm-hmm.
And this is concerning because it means we don't have representation.
Well, you should know. And this is why I brought up the Constitution of the NDP. Yes. It is actually in their Constitution that they have to vote along party lines. Like, know this when you're voting for a thing. Is that, if rag on the Liberals, rag on the PC, the CPC, but well, there is no CPC in British Columbia. But like, rag on the Liberals all you want, but at least a party member can have conviction if they wanted to. It's hard to find that in that part, whatever, and people can be partisan or whatever. But know that the NDP have to vote with the party lines. Like, they don't have the choice. So if you're voting for them, you're voting for the party. You're not voting for them, that individual person, to represent you. That's just off the table anymore. And that's the NDP.
And historically, everybody is like, well, don't vote for independence because you need that block. But it's like, but if the block is actually destroying your life, then what is better? Is it better to have a vote that actually is for you? Like, I'm just wondering at this point if we need to start focusing on independent people so that they're not put under the pressure of these party politics, and we can actually maybe get a little bit more balance to the decisions that are going on, because right now that's not occurring. And
it's hard though. It's hard though because it's a branding game. So like, when people go to vote, they're not paying attention. We had a mayoral vote in our place. Everybody had that recently. You go in to vote, and it's just, they were all independents. And it was, I don't know what anybody's platform is. You go to their website, and it's, I want rainbows and unicorns for everybody. That's everybody's. Hello, let's make it great. I mean, the slogans are the slogans, and you don't really get an in-depth, like, there is no place where you can see a debate, any of this stuff. They come door to door and they tell you, some young kid tells you what the platitudes of the party or the candidate. You don't get to know. So I mean, there's an argument for both sides, but a lot of people, they end up, for this reason, going with the brand that they know. They're like, okay, well, I know this brand stamp, I'm gonna go with them. At least it kind of, it gives me an idea of where that person stands. But that's been subverted in the past, like, few decades here in Canada, where the parties they don't stand for what they used to. They're all just kind of towing some other line that they have. I mean, I'm not gonna say conspiracy theories or whatever, but like, I think they have ulterior motives. I think they have motives that don't align with the voting public, and they'll just say whatever they can to get that seat. You know?
Well, I don't have a solution for cities because I find that in cities, neighborhoods aren't as community focused as
Mm,
maybe rural locations. And I'm in rural BC. So in my riding, I happen to know that, within my area, so it would, I don't know, be 200 kilometers across it and probably, I don't know, 150 high. There are pockets of groups that are all over this riding that have already formed and organized and have concerns about what's going on. Now, some of them are addressing things that are going on in the education system.
mm-hmm.
Some of them are dealing with environmental issues. Other ones are food sources. And so actually the next thing I've decided to do while I'm waiting to see if one more protective mechanism in our society fails or not. That's you, Labor Relations Board.
I knew it.
I am actually starting to connect with leaders in those different groups. And we're going to try to see if we can organize a better network of communications. Because if we can start establishing the ability to communicate quickly and then start to address things like food production, because we do have lots of farms in the area. If we can at least find out who's producing food, how we can get it transported. We have other private healthcare that is actually people who are doctors and dentists who are actually choosing to let their licenses go. And they are in the process of trying to form these private membership associations.
Mm.
There are things actually in play in this area that I think are the seeds for what we can grow. But the next step in which I will be more involved in is now getting all of these skills and people connected and try to find a mechanism that we can actually start to rely on ourselves. So the concept for me is, instead of a parallel government, I'm looking at creating a government within the government. And the first step in that is all of these pods that have already developed, because they are present, is now just getting us coordinated in a way that we can actually assist each other. And so that's going to be progressing, because out here, there is definitely an increase in anxiety over the direction that the government is taking, especially even with these threats over confiscating firearms, when a big part of our population are hunters.
Mm-hmm.
And this is how they get food, and especially when grocery prices are going up. And it's just like, why would you implement things that could actually make people starve? is sending off warning bells. But this is where this last year for me has been, I've been operating on what I call the crazy idea, which is, I don't know what to do, but this crazy idea comes. And so I try it, and somehow it actually works and it does something. And so I'm looking at this right now going, it seems insurmountable, the corruption that has invaded our leadership in this province. But I do know that present within our population are people with strong moral codes and ethics and understanding of what justice is and what democracy really means. And that the whole point of being a human being is your ability to live your life in a way that you can become the best version of yourself.
Mm-hmm.
And trying to embrace those principles, like, because we have that present, we do have the potential that we can change this. And so that's why I'm like, okay, you know what? I'll be dead soon. I can try this once. I can see if something this crazy would work. What have I got to lose? And so instead of going to Alberta to get a job as a nurse, which I could do, I am going to stay here, and I'm going to be a social agitator.
Yeah.
And I'm just going to keep making these videos and telling the public what's going on. And then I'm going to see if I can start my own government.
Well, like I said, it seems like just a logistics problem at this point. We have
I know.
all kinds of, well, really, we have all the willing participants in this thing, and
Yep.
we just have this burden, this big weight on us. You know, it's
Yeah.
this big weight on us of people who their only job is to disrupt and stop us from doing what it is that we're. And you know, they say the road to hell is paved with good intentions, right? Like the whole concept of all of these overseeing bodies is that, you know, everything is handled correctly and everybody does the right job and all this stuff. But then, I mean, the only tool they have is a hammer. This ban hammer to ban you from being able to do your job, ban you from do this, shut you down, turn you off, you know, get in your way. That's all. That's the tool they have, and they're just using it. They're using it on everybody. They just need to get out of the way. That's the thing. And if it has to be like a government within a government or a parallel economy or whatever you want to call it, it's what it is willing participants in a society that all want to do business with each other. They all want to interact with each other, and we're just sidestepping a big nobody that doesn't need to be there.
Well, and I'll tell you, you know, once I start getting all this communication going within my own community, if there is the temperature of the population is indicating that they are not happy with our governance, then I will do a recall on our MLA. And if we're successful, and I'm not going to proceed unless that is actually what the community feels. I don't feel any need to keep practicing a hierarchical authority thing that's not working. But if the community itself feels that this is something that they want to do just for shits and giggles, we will recall our MLA just so that we can pick off one at a time.
Yeah.
And, you know, that's all you need is you just keep picking off one at a time until one day, actually, then the votes start going in our favor. And there's a lot of things that could be done. Simply, how about unions actually have to disclose their financial operations with a forensic audit of what money they are collecting? And by the way, all that money needs to be directed to representing members, not for giving to political platforms. And how about we get rid of 6 health authorities and just go with one provincial system so that we are all using the same communication systems, because currently we're not, and we can get rid of 6 layers of management that we don't need. Or how about even with the nursing school program, instead of it being this degree in a university, how about we make it a trade like it should be? We're hands-on. So year 1, you're carried. Year 2, you're an LPN. Year 3, you're an RN. Year 4, you can do specialty. And if you want to get into the academic stuff, you can do it at that point. But it is not necessary to know APA format when you're doing CPR. There are things that are worth prioritizing and other things that have just been instituted to make money for educational institutions instead of actually equipping people to do the job. There's a lot of things that we could do. It's just that the people who actually have the good ideas like me never get to be in charge.
Well, maybe you should be in charge. Maybe you should be in a position where you're in charge. Another thing I just thought of, it was we hear a lot of people say about term limits, that we should have term limits in government. What about in unions? What if there was term limits on who the union bosses can be, and they'd have to be people who are actually members of the union, like union due paying people, and then they could run for. This is how it used to be, as far as I was aware, that if a union organized and you get the union bosses, they would be the workers. The workers would end up as the union boss or whatever, and they would be running the show for the union for whatever amount of time. But if they had the whole idea of having term limits on anything in government is that you don't have these like endless bureaucrats that or these people in government that just they're part of the permanent fixture in Ottawa or in your province or whatever. That you get a cycle of actual just everyday people entering. They want to take up the reins for a period of time and then go back after they're done. Maybe even making term limits on bureaucratic positions in.
Well, the only thing I'm worried about with that is, for instance, you vote somebody in here and they're new. Okay. So by the time they actually figure out how to do their job and the game that's played, then their term limit could be over. So I'm worried that you're consistently putting people into that system where they're not equipped. What I would like to see probably is a better wise. I keep thinking of it as a wise counsel, in that any MLA should have to have a minimum of 12 people from the community that they have to counsel with and find out what the priorities are. And they have to come to an agreement as to what the agenda has to be before the MLA takes it to the province. Just trying to, and for the union, just make them have, for the labor board, the rules could be that the union has to actually disclose information when it's requested. Otherwise, they lose the ability to be, what's the word? There's a certain word in which they're allowed to actually do the bargaining for the union. And if they don't disclose information that's requested of them, they lose that right. So right now, we sent them 12 pages of questions when it came to not just the finances, but how many employees there are, where we are with grievances. There was a lot of specific stuff that we put in there. We sent it in general email 3 times, and then they have a whistleblower policy as to how you submit it again, and they're supposed to respond within a certain amount of time. We followed the whistleblower policy. They just refused to answer us. So it should be part of the labor board that if a union refuses to disclose stuff to its members, well, then they lose their certification. They lose the ability, and then another union can come take their members. That would actually help things.
Are there different unions in the medical field?
Oh yeah.
Oh, okay. So you're part of one union, but you're not. It's not the only union.
No. So there used to be the hospital, or there is the hospital employees union, and some of the nurses were actually in that union. The practical nurses, the licensed practical nurse, and then our union raided that union, which was kind of unethical how they did it. But now
I just immediately I'm picturing, like,
but it might be
battle
time for
axes and Vikings
HEU now to raid back.
Okay, I don't know what a union raid is, how it goes down, but that's funny.
It's just that the lack of law, because that's, the times when we need law, it's not there. And then the times when we don't need law, that's when they got their hands in there. I don't know how to, I don't know how we're going to balance this. Like I said, we have to look at this as this is a long-term strategy. You need to pace yourself, because the amount of speed that we are working through in finding out how many things are not working. I'll give you another example. My property taxes this year, my assessment went up 70%.
Oh,
I was the only house in this whole neighborhood that went up 70%. Everybody else was averaging 23 to 24%.
Wait.
This meant that my taxes went from $5,200 to $9,500 last year. Now, I went through the local appeal. They ruled against me, and so I took it to the provincial tribunal, and I actually had a formal appraisal done who came up with numbers very close to mine. That provincial tribunal would not accept that appraisal. And so as a result, my $9,500 property tax is what I have to pay. So here we have an issue where appraisals are used for financing homes for banks, but a provincial tribunal will not take that as evidence as to what a property is worth, even though that appraiser was in my property and was on site
Well,
and
because they want the
did it
greater
for me.
number, because that's the number that they base their municipal taxes based on.
There is no appeal for this process. The only thing that I can do now is to take the province to court. So all this did to me was it exposed one more area where there is no protection for us. That the government can decide what your property is worth. They actually are using drones to monitor your property, which is against privacy laws, but there's no one enforcing that either.
Mm-hmm.
And so now we have an example of my situation where the government has decided that no matter what evidence is provided, they're going to double my property taxes, and there's nothing that I can do.
That's insane.
So that's just one more example of what's going on.
Holy cow. That's too much. And the thing is, a lot of these municipalities all over British Columbia are pulling in more tax revenue than they've ever
Yes.
seen. With more houses being built all the time. There's a whole economy around the house flipping and all of that stuff. What you were talking about earlier was the some of the stipulations that, and again, road to hell, paved with good intentions. One of the things they used to do was if you owned a piece of property, and what was it? If you owned a piece of property, you couldn't just sell it, and you'd have to pay profits and gains tax. And so what they did was they said, okay, well, if you lived in it, if it's your house and it's your primary resident and you lived in it, then you have to live in it for at least a year. And then you could sell it and you don't have to pay the profits and gains. So all these people that were in the Vancouver market just buying houses and then flipping them, not doing anything to them. Like most of these houses, they weren't even doing renos. They were just buy it, hang on to it for a bit, flip it. And that was a huge industry. So they would buy these houses, and that's what they would do. They'd sit on it for a year. They'd get a utility bill in their name for a year, and the house would sit empty. They wouldn't rent it because of the same reason that you were talking about earlier. If they got a renter, now the renter has rights, and now that's a hassle. And you sell a house with a renter in it, it lowers the value of the house. So they would just let these houses sit empty. And there was entire neighborhoods in Vancouver, the most expensive place in Canada to live. They're just empty, completely empty.
Yeah, and then renters are angry because the owners are taking advantage of us, and they're blocking up housing with Airbnbs.
Mm-hmm.
But the reality is I was a landlord. And I used to use that term lease. And so I would do a term lease at a time, and then we would renew every year. And you follow whatever the rental increases are that are legislated.
4%.
And it worked well because then, in advance, they could leave if they wanted, or if I was having to do upkeep or maintenance on it that was significant, then I could give them notice a few months in advance. Like in advance, I always did like 6 months or whatever. And it's like, okay, we are going to be able to renew, or we're not going to be able to renew. But I never cut the lease off ever in my experience. It was always the renter moved on, and it always worked well. But now that they've made that illegal, I had a situation where I had a building that I had to get demolished. And because of the rules, I could not get that person out for 4 months. And the process was very difficult for me. And so now I'm just like, I would rather, for my benefit, because I've had issues now with tenants that have caused me hardship, even when I've tried to be a good landlord, it's easier for me to have Airbnbs because then I'm not caught in these conflicts.
I didn't even know this aspect of it.
Yeah. So I mean, the rules around that need adjustment. That term lease actually worked well. They removed it, and now they have unbalanced things to the point where now landlords are just like, you know what, we're not even going to deal with renters. Then it creates harder, like it creates circumstances for people that it makes life worse than if they had just left things alone.
Yeah. Yeah, absolutely. And like that's the thing. So there's going to be slumlords. There always will be. But what most people don't hear about, because most people aren't aren't landlords, is the amount of horrible tenants there are out there. Like there are just some really, really bad people to rent to, and it's quite an investment to have an investment property, and then every month that it sits empty or someone's not paying rent is a tremendous cost to the owner. And yeah, a lot of people just don't think about that aspect of it. It's pretty.
Well, even the last year, I was surprised at how many people stayed in variable mortgages. And I am running across people all the time now who are paying $1,700 to $3,000 more a month from last year just because the interest rates went up.
Well, they just reset.
How is that going to be sustainable?
They just went up again. Joe, did they just go up to today?
25.25.
Yeah, there was another 0.25% raise. I think it was yesterday.
Another 0.25%. I was expecting two basis points. I thought it was going to go up 0.5%, but that's it just keeps going up, and it needs to go up much higher if they want to curb this inflation. I mean, you have to look back to the 1980s, the early 1980s, late 70s.
Yeah.
Paul Volcker and I think it was it Volcker or Greenspan that did that back in the 80s at the Federal Reserve. And of course, we dealt with it in Canada. For anyone that thinks that we're an independent economy from the United States, and like that's just no, it's not happening. What the Fed does is what we end up following suit with. They inflate the crap out of their currency. We do the same thing. Or else our dollar appreciates, and then it kills all trade, cross-border trade, of all those raw resources that we ship off untouched.
Yeah. And honestly, anybody that's in a variable, get out of that variable right now, because the foreclosures that are going to be lined up for this next year are significant, and you will be caught. This is not the end. You will be caught.
So this is an interesting time because here in my town, prices are down 20%. Like that's so all the real estate agents are telling everybody, just wait. The buyer's market's just around the corner, right? You want to get in while it's high, what? Anyway, so they're down, and they're down for the first time in a long time, since like the early 2000s, or maybe even before that. But like they kept climbing, and there's this bubble economy all around it. But if the housing market was to pop, we're in a situation where it's not just real estate investors that are going to be sore in this. It's going to be everybody. If you look around the town that I live in, you'll see every other house has a 3-letter construction company truck, because you have all these sole proprietors that are businesses. This is what people are doing. This is an entire chunk of our economy is built around this housing bubble, and people building new houses, people servicing the new houses, people bringing electricity to them, all the trades. I hardly know anybody who works in service room repair when it comes to electricians, plumbers, all of this stuff. They're all doing new builds, and that'll come to an end when people are selling their houses just to get out of them. And where's the bottom? Like, where would the bottom be in that?
And then when you put people in such a financial stressful position, and then tell them that if they don't do what the government tells them to do, they're going to lose their jobs, what's going to happen?
Well, what's the out? What's the like I said, where's the bottom? Where's the bottom? Where does it end? It would be a lot of people leaving where they're at.
Yeah.
That's for sure.
Yeah, which is why, well, do you know what the stats are of the population increase that's happened in Alberta in the last year?
You got
Have
that?
you seen this?
Let
Got
me
that,
look it
Joe?
up.
I know that it's huge. I know.
Yep.
I think, what is it? Calgary's like the biggest growing place in the country.
Yep.
Yeah, Calgary has grown a lot. I'll see if I can pull it up, but there is a map of downtown Calgary that showed like 10% of the units for businesses and homes and everything were actually had people in
Wow.
the downtown core.
Because that's going to give to us an indication of how insecure and afraid people in this country are. If they're flocking to Alberta at that rate, because that's one of the only provinces that is actually standing up for sovereign people, yeah, it's incredible.
Yep.
That indicates to me that this Canadian population actually is afraid of what's coming.
Is that an
down.
Al Gore graph you just brought out?
Right? This is the climate graph where every person represents another degree Celsius. No, this is Alberta population history, and it is very much on an exponential growth curve.
Yeah, it's shooting way up.
I'd like to know the last 2 years if you can find it.
Right here, 5-year percent change, 10-year population from 2016 to 2021, not quite the last year or so. It was 250,000 people over 5 years.
And that's just in one city.
No, this is across the province.
Oh, that's across the province. Oh, okay. I was gonna say,
but really,
Calgary, 250,000 people. Wow.
It's Edmonton's a million and a half ish. Calgary is 1.5 million ish, and then the rest of Alberta's across that 4.26 million.
Wow.
Yeah,
Edmonton, and they're getting all the professionals.
That's true.
Yeah. Well, we're good. Well, it's kind of good and bad in a ways, because it's nice for people who are consuming those services. But then if you're a professional trying to move to Alberta, all of a sudden you're competing against a bunch of other professionals, all for the same position. So you may not see the wages. You may. It depends. It depends on how fast our economy grows with the oil price.
Mm-hmm.
There's lots of factors to it, and it's not a given that you'll make more here, but it is a given that it'll be less expensive to live here.
Yes.
Well, it's less expensive, and in our case, you can actually work. And so I have a ton of nurses that are working in Alberta. They're actually starting at $52 an hour when the highest rate here is 47. And they're being met with open arms, where here it's pretty hostile. So, I mean, for any nurse out there, I'm going to suggest that you at least and if you want to keep working, you should at least get your license ready to go in Alberta, so that in the event, if you do need to leave, it's ready to go.
Well, that's why I was saying I was afraid, here comes the upcoming election, and Notley, who knows, Notley may have a chance to actually win, and then it's BC all over again, right? And Alberta already had trouble with Rachel Notley when she got elected the first time. The amount of jobs lost. I mean, she created a ton of government jobs to counteract, so it looked like it was okay, but there was a ton of jobs lost, and them shutting down industry, and it was a big upset. And I'm hearing now. Tell me if you know this, Joe. But apparently, Artur Pawlowski is actually running in this next election.
Is he? I wasn't aware, but
apparently
on the jobs front.
Well, apparently there's a big scare that he might split the vote like Smith did last time to get Notley in.
Is he running for Conservative, or is he Wildrose?
He's running for some independent.
Okay.
Or I'm not sure what.
That's news to me.
Yeah, it's all I didn't look into it that deep. I just heard about it.
I'm going to see if I can pull up Alberta private versus public sector jobs during Notley. It's an absolutely disgusting graph.
Oh, okay. Yep. Let us know when you got that one up. That's gross. That's gross. But so Corinne, I got a question about because you were saying before the last time I spoke to you about how there's like private non-union employees working alongside with union employees in British Columbia. So if the union, so like if the, I'm trying to get my head around this. The union controls everything. You can only be employed by the union, and you can only be employed through this like conglomerate of a union essentially for the hospitals. How are these other people getting shoehorned in there, and how does that work?
So to be an employee of a health authority, you have to be a union member. However, they do not have enough employees to staff hospitals. And so then there are private companies that hire nurses, and then they contract them out to the health authorities to work in the hospitals. But they're technically the employee of the contractor, not the health authority, and they do not have to be unionized. They also cost the system 4 times as much because they usually get paid, the travel agency nurses usually get paid more because they don't get pension and benefits and that kind of thing. So they get paid more. And then the system also has to pay for their accommodation and their travel. So a travel agency nurse will cost the system approximately 4 times what an employee of a health authority is. Now, just about every hospital I've come in contact with is functioning because they are bringing in these travel nurses. And right now, our BC nurses are working in New Brunswick as travel nurses, making $90 an hour while they can't work here. Now, this whole thing about bringing in foreign workers, I would like to know what the plan is about unionizing them. Because if they are made to be union members, then you're almost diluting the membership with people who are only in their job because the government is allowing them to be there. And so there is a little bit more of a coercion factor in terms of how voting would occur. So I'm just looking at the long-term play of the government and unions. And I am suspicious that the government is trying to destabilize. Well, we know that unions are neutered, but if they can destabilize their position in society, then there is like no mechanism to protect workers in that sector. So I've been trying to figure out, okay, what's all the angles on this? Why are they making these decisions when it's just so ridiculous? So, I have to admit, I am suspicious. My antennas are like really vibrating. But if anybody has input into why it would be beneficial to bring in so many foreign workers and not employ your own people, I'd certainly be interested in listening to that. The only thing I can think of is that in order to create this globalism that's going on, they have to bring in foreigners into countries that before had been maybe more patriotic or more nationalistic. And then this actually dilutes that nationalism and patriotism because you have such a mix of multicultural components in there. So I don't understand all of the thinking behind it. So I'd be curious if other people have ideas around it.
Yeah, I'm curious what the motive is. I mean, I have no issues with immigration. Obviously, my wife's an immigrant, and and she's of another race and all that stuff. She's Japanese, right? So we have a thing in common. We both married someone Japanese, and we have beautiful children as well. But
we do.
But the thing is, like, I obviously I have nothing against immigration because my wife's an immigrant, and my mom was an immigrant, and my dad's an immigrant, and I'm a first generation Canadian. So, like, immigration's great, but I'm a Canadian, right? Like, I don't identify as these other things. I identify as a Canadian, and this is what immigration is. Now, other than that, if we don't have that, then people are coming for what? They're economic migrants. If they don't have allegiance to the new place where they want to live, they could just up and go. That's kind of like, okay, I'm here while the getting's good, and then I'm out. Is that the kind of people we want to be welcoming into our nation, or we want to be welcoming people that want to be Canadian? I'm more of the camp that anybody who wants to come and be Canadian and live in a country and celebrate what it is that we love, and then contribute as well, bring their culture, and then it can be part of our culture too. I'm all for that. The economic migrant thing, I think, I mean, it's less desirable.
Hey,
Here's the.
I managed to find this. It's from the Fraser Institute. This is from 2014 to 2018. For reference, Notley was in power from 2015 to 2019. In this time period, we saw a net increase of 78,733 new government employees, public sector work. I believe this number includes not just people working specifically for the government, but also contractors to the government, people paving roads, etc. All the things that our tax dollars are spent on. And for private employment in that same time period, we lost 46,267 jobs that brought money into our economy, that generated value.
That paid, that you got taxes for, and then paid for those services that cost money. Like, you can't get blood from a stone. Like, I don't get, like sure, social safety net and all this stuff that they want to bring up, that we should have a social safety net and all this stuff. But at the end of the day, if you can't pay out more than you can bring in, and then all you're doing is you're burdening everybody else more and more. And this is why we have all these new taxes all over the place. We're getting a new beer tax in April 1st. Perfect.
Really?
Yeah, perfect time for that. A new 6.8% tax on beer in Canada.
Okay, so how come there's no response to this? I don't drink beer, so I don't care. However, I would think that the beer drinkers
I'm one.
would be kind of pissed off.
I have my wobbly pops every Friday after my live stream, and I have wobbly pops with the community here on the internet. And I'm pissed. That's just more revenue that they're just soaking out of like I said, you can't get blood from a stone. How much before people are done? Like, they had a tea party in Boston over a couple of cents, you know what I mean?
I have a creative idea. You brought one up for me for striking. Here's my creative idea for all the beer drinkers out there.
Okay.
April 5th or April 1st. Nobody buys beer in this province until they stop taxing you.
That's not ever going to happen. Oh, no. No way. No. COVID outbreaks, the deadliest disease to ever hit mankind in the modern age. So they said, and everything was shut except the liquor store. Like, did you see any liquor stores shut down? They were essential workers, and they were busy, not like the nurses. They were told to sit around and wait for nothing. That's crazy.
Okay, I got another idea. Let's bring in truckloads of beer from Alberta.
I'm on board. But it's all across Canada.
Oh, it's a federal tax?
It's a federal
tax. Goodness. Oh, okay. I missed that part.
Yeah. Yeah, it's a federal tax. Because I'm all about Smokey and the Bandit. I would love that. We need a good mustache. and a sports car.
You just need to import Canadian alcohol from other countries like Japan.
I always drink my Asahis, man. That's the beer I always like to drink when I'm having my wobbly pops on my Friday after the live streams. But yeah, I mean, that's what we need. We need more. This is what's gonna happen. Bootlegging is gonna happen.
I have a question, guys. Okay, so when all this vax stuff came down, I knew that people were getting fake vax passports to be able to work.
Yeah,
it
that's
was
right.
like, it was pretty common, right? I chose not to on principle.
Mm-hmm.
But lately I've been thinking about, Second World War and all the underground movement. And those guys all had to use fake identification to be able to move around
Papers, please.
and
Yeah.
their supply chains and all that kind of stuff. Okay. This is my question. At what point do we start using what could be called unethical responses to right the imbalance? Like at what point is it okay that we start going underground and doing things against the government to protect ourselves? When is that line? This is what I want to know. I need to talk about this with somebody.
Yeah, so Joe, pull it up if you can. There's a Utah doctor and his nurses. He was a plastic surgeon from Utah that just got busted for doing this. And they had this like elaborate thing set up where it was word of mouth only, and you had to be referred by somebody. And he was a plastic surgeon. He enrolled himself to administer vaccines. And what he did was him and his nurses and some other people at the clinic. Oh, you got this up? This is why the feds just busted Utah doctor. Hint, it's about the COVID vaccine, right? So what they did was they had a system of like texts that they had set up, and you had to give like a certain emoji in the text in order to get past a person, and there was checks and stuff that they went through, and eventually the feds, the FBI, investigated them for this, and found out that he was giving out fake cards at $50 a pop, because I mean it's a risk to him. They found out that him and all these people made like $96,000 out of the whole thing. Now, $96,000 between a whole practice of medical professionals is not a lot of money. That's a drop in the pond for the risk that they're taking. So obviously they're in it for the ideological thing. And it turns out that they were part of an organization of people fighting against this stuff. So it kind of tells you where they were on that. But what was most interesting about this whole thing was the fact that what they busted them for. Did they bust them for going against COVID regulations? Did they bust them for going against a mandate for vaccination? No, they busted them for damaging and destroying United States property. The vaccines that they poured down the drain.
Really?
Yeah. And it looks like they might serve jail time for that. But they couldn't. I mean, obviously they would have got him on something else, right? So that was the news for me out of this whole story. Was okay, obviously, like this person trying to do what he thought was the right thing and give people an out, papers please, the whole Nazi checkpoint kind of ordeal. Yeah. And he's like, okay, well, I'm going to provide papers, and they'll be legitimate papers for people. He was actually even giving kids saline shots so that they thought they got it for these parents. So if they went to school or whatever, they'd say, yeah, I got it. And they wouldn't be lying or whatever, right? couldn't be interrogated out of them. This is the world we're talking about, right? Interrogating children about whether they got something or not. But what really troubled me was the fact that how unlawful this stuff all is. Mandating these on people, to the point that when they enforced it on a doctor in Utah, the enforcement came down on him that he destroyed government property because the government had paid for those vaccines and he just he sent them down the drain. So that's his crime.
Yeah, when you start having unethical governing, I don't know how to be able to hold them to account using ethical principles. I don't know that it's possible. So it's hard for people like us who are not evil. We're by and large, responsible, trying to contribute, or raising families. Like, we're doing all the things that should be characteristics of like a good human being. And it's not in our natural instinct to understand why there would be such an intention of harm towards somebody else. So because that's not in how we think about things, we don't necessarily have the skills to know how to identify it or to know how to respond to it. We're getting way better at the identifying part, but I'm still not at the place where I have a clear picture of how to respond to this. Now, I mean, you do things individually, like I went into a store last year without a face mask and had the police called on me. And
Whoa.
I tell you, like, I'm still scarred by the fact that in my own community, it was more important to my community to call the police on me for not wearing a mask than to appreciate the fact that, I've saved their lives in the hospital. It's just how, when you come face to face where what is actual human intention to harm you, how do you respond? I'm having difficulty with this.
Yeah. Yeah, well, I have a hard time with it. Like, if we're in a situation where people are going to be harmed by other people because of some arbitrary thing that makes no sense, it doesn't make sense now, and we're even at the point now where people are asking. They're not asking for forgiveness. They're asking for amnesty. They don't want, because they know what they did and they don't want to come to grips with what they did, so they just want to move past it. And yeah, go ahead, Joe.
Mind if I interject a bit here? I have a real hard time when it comes to attributing malice to people. Maybe it's the optimistic side of me, but I feel that a lot of the harm that has been done again was done with the best of intentions, and people not being able to see the damage that they're doing and justifying away their own actions in their heads. And it's really, really the worst thing that I think has happened for society is like the breakdown in communication between the various groups within society. Anybody who's ever tried talking across the aisle, so to say, you the conversations that you have, by and large, very, very few of them are productive, and those that are only seem temporary. So, and I of my own ideological bent feel that it probably feels the same way for some of these people, where they're continuously worried about said thing, And the more that they hyper focus and fixate on the thing that they're worried about, and the more that we brush them off because we don't have the same perspective as them, they probably end up in a similar sort of situation, thinking and falling back to that underlying attitude, well, they can't all be ignorant. They're probably a bunch of evil people too. And then that just kind of rifts society apart even more. And yeah, it's really unfortunate. And if there are any people out there watching this that do not agree at all with what's being said in this podcast, reach out to us. We'd be interested in
be happy to chat with you. And not like a debate me bro kind of thing.
No, we want to understand your perspective.
Yeah, honestly.
Well, could I add in one thing here? So, back to my husband's family, when, all the Japanese were loaded up in trucks and everything taken. The weak spot there for me was the fact that only occurred because people stood by and watched. And I guess like that, even though that history did not happen to me personally, it has somehow impacted my thinking in that I cannot be one of those people that stand by and watch abuse happen to somebody else.
Yeah.
And that's my own personal journey, and everyone is going to be facing that themselves in what they determine to be the point where they would actually step in to assist on something. But you never know until that moment who you really are. And so to me, that is, it's not a matter of being intentionally malice. It's a matter of that you yourself could allow someone else to be abused and you can stand there and watch it. That to me is the point that we need to look at.
What's really sad though is that we're all capable of it.
Yes.
And we got to realize that. And you got to really look inside yourself and think like, wow. And the conspiratorial side of me wants to say that, like, look at all the times that they've done this to us, right? Or maybe it's a phenomenon. It has nothing to do with conspiracies, or maybe it's a conspiracy. I don't know. But like, even look back into our own past in our own lifetimes with September 11th, and then the subsequent TSA overreaction, the new infrastructure that went in place. And in Canada, I can't remember the acronym for it, but it's some TSA kind of acronym, but it's a security state. But they would, for a few decades, they would profile Middle Eastern people, and we all just kind of let that go. That was just a norm. Well, whatever, like, that's where all the terrorists are coming from, right? But this was a profile, and like, people actually went through hard times because of this. It's not on the same level as what happened to the internment of the Japanese. It's not on the same level of what happened to the Jewish people in Germany, but it is something on a level. And it was a type of discrimination that everybody was just kind of okay with for a good chunk of time. And that's sad, because I feel like I didn't really do much about that at the time, and I regret not having done much about it. You get what I'm saying on that? And I think it's on par. I don't think it's at the same extreme, but this is what we're all capable of. And when you look back and you look at the scenarios, it's the only thing you can do is kind of look forward and try to guard against it. I mean, look at the Ukraine war scenario. I mean, how quickly everyone went from COVID to putting Ukraine flags in their bio. And for what? Do they have any history with the Ukraine? Do they know anything about the Ukraine? Do they know anything about what even recent history of what happened in, it's called Ukraine now, not the Ukraine. I mean, there's all kinds of stuff many of us don't know. It's a bloody, messy situation, but you've got people coming at you going, no, it's very black and white. It's this. I'm not going to buy that. I'm just not going to buy that, and I'm not going to throw my biases out. I thought it was dangerous in the first few weeks of it happening. They suspended a flight in northern Yukon or something. I reported on this, where there was Russian nationals on that plane, and they said, we're going to have to hold these people and, you know, detain them. I was like, we can't go here. We can't be going here with this. This is just wrong. And we've been there in our history, and we don't want to go there again.
So how do we call it out in a way that is...
Well, there's this idea of mass formation. I don't know if you heard of it. Mass formation.
Yeah.
There's a book written about it.
But let's talk about it in a way that it's not like using terminology that is categorizes things.
Okay.
Like when we're like interacting with somebody that it appears that the belief system that is being expressed justifies discrimination or judgment
or mistreatment, like actual mistreatment of people.
Yes, and mistreatment. What is an appropriate response
to someone trying to justify mistreatment?
Yeah, so like all of us have encountered situations where, and we even probably find ourselves responding that way too, when we feel like we have to make a point or win the argument, or just think that our opinion matters. Like when we come to this impasse, because I don't know, unless we can figure out how to actually bridge these fractures in our relationships, not just individually, but collectively.
Mm-hmm.
If we can't figure out how to bridge this, we're not going to be able to form a healthy society, because it's a
vulnerability. It's an absolute vulnerability, and would-be despots could use it to their advantage to compartmentalize society and break people up, and it's the old divide and conquer thing. So, and that's my conspiratorial side of me, where politicians could use this to, look at Justin Trudeau. He fractured Canada with his rhetoric during the pandemic. And say what you want about people's opinions, he went on television and said that people who are vaccine hesitant are often misogynists, they're often racists, they're often all these other things. They're epithets of behaviors that we don't like, and he's equating them to people who just don't want to take a medication that's experimental and could be a risk to one's health. And I thought it was bodily autonomy. We hear these arguments with, I could get into the arguments, but the point here is this type of behavior can be weaponized against the public. Mm-hmm. And we got to be cautious. We need to be aware that this could be used against us, and we're susceptible to it. It's a real vulnerability. It's a liability of ours. I don't know the answer.
You said it well. At least if we can recognize it within ourselves, because the point of our life experience is not that we're out to change everybody else. We get to change ourselves.
That's the hardest thing, though.
It's a good thing we got 70 years to do it. It took me this long to get this far. But yeah, in order for me to become the better version of myself, I have to be able to identify what the glitches are, and you did articulate that very well.
It's really hard, though, because introspective is how we have to look. right? We have to look introspectively. We have to see where we're failing. But it's an innate human thing where our ego won't let us do that. And we're in a century of the ego. We're in a brand new century of the ego where we have Instagram constantly. People are, they all know the pose. All the girlies know the pose. Like, stick your leg out this way, it makes your ass look big. Like, this is the thing. It's all about ego. It's all about how you look. It's all about how your outward appearance. And they cannot damage their own ego. And I think the best example of this recently was Sam Harris. Do you know who Sam Harris is? So Sam Harris, he's known as an intellectual in the United States, world stage, but he's I believe he's a neurologist, and he's one of these thinkers. He was one of the four horsemen of the apocalypse when it came to the atheist movement, and he's I don't know, he's a big, well-known thinker, and he went crazy with the Trump derangement syndrome so all of his smart brains and all of that went out the window when Trump got elected. And then again when the COVID-19 thing happened, and he was fiercely on the side of like anyone who doesn't get the vax should be thrown away and like discarded from society and all this stuff, right? But he recently was in a podcast where he went on this really bizarre rant. And it was a really interesting rant where he was trying to justify in his own head where his thoughts were. We all know that they were wrong. We all know that, the transmissibility and all these other things about it, which is the reason why it was mandated, the reason why it was pushed on people and coerced into circulation. We all know that, and he admits that now. He sees that there's no reason for it because the transmissibility argument's gone, and the mass formation or whatever it is, the frenzy has worn off, and the hunger pangs to go after people is gone, right? And now he's in justification mode, and instead of just admitting, I was wrong, I'm sorry, I shouldn't have been so vitriolic, now he went into this really, really bizarre tirade where he said, if only one thing, you take the whole scenario, and if you just change some of the parameters in the scenario, what if COVID was really dangerous? What if instead of old people that it was harming, what if it was the young? Then in that situation, I would have been right. You're like, hold on a second, man. You can't just change the circumstances. Now you're making it a dangerous situation and a thing that would have justified the things that you were going for, or maybe justified it, maybe not even. And then we could have had that argument, but no, he's gone on this other thing where he's changed the whole scenario in his head, and now, okay, well, I'm still justified. And this is this weird cognitive dissonance that we're seeing with even the people that we hold up as the smartest people in our society. How do we cure ourselves from that? How do we cure ourselves from the ego that stops us from actually moving past all of this stuff? Because we can't heal without people admitting that they were wrong. Without there's no forgiveness if there's no admission.
I think somehow we've allowed our beings to get out of alignment, and the whole spiritual component of who we are, I think we haven't done a very good job at teaching and inspiring and incorporating those tools into how we express who we are, or how we make choices, or how we live this existence. And I really feel on some level that there is a call back to awakening that part of ourselves again, because I feel that a lot of the distress that we as beings feel is when our own person is not in alignment. So, say your head is telling you something, but your emotions aren't getting it. And so there's a disagreement within yourself. And, people end up having anxiety and depression. And it's just because there's parts of us that have fears and insecurities that we aren't dealing with. We're just allowing the emotional response to guide everything about our lives. And I guess this last year for me was important because, I've never been in a place before where I haven't had income. I've never been in a place before where my own community was calling the cops on me, or that, the skill that I had worked so hard to get was, I wasn't allowed to practice it. Like, every part of who I was as a person was really challenged, in that the external sources were really communicating that I was devalued. And I had to really fight to establish within myself the understanding of who I was, and why I was the person I was, and why I had to make the choices I did. And in doing that, somehow within myself, I found myself, that the parts of me that had not really been functional before had to get engaged for this experience. And I found that now I myself, even though my external circumstances are still unstable, my internal person has reached a confidence level and a sense of empowerment that I have never felt before. And so I'm grateful for that. And I'm grateful that as I'm willing to do the crazy ideas and take steps and see what happens, that, I don't know, it's almost like the miraculous gets to participate for once. And I'm looking forward to that process. I'm enjoying the encounters that I have with people like you, and the fact that, this level of communication is being made available, because the whole point, I think, is to help us become better versions of ourselves.
And we're coming out better because of it. It's amazing. It's amazing. Like how horrible this past few years has been. So much good has actually come out of it, and the networking that we've been able to pull off is amazing. And I've been able to meet you, and I'm so thankful. I'm so thankful for this whole scenario. It's really mind blowing. I never thought I would be in this position to talk to such interesting people like yourself. Corinne, where can people find you?
Oh, yes, please. Okay. We have, for the nurses, the website. It's bcnursesfightmandates.ca. So there's a lot of information on there. As well, if you want to get a hold of me by email, just use stopmannow. So it was like Stop the Mandates, but stop, S-T-O-P, man now @gmail.com. And you know what? I keep my profile open on Facebook. So if you want to private message me through Facebook, you can find me that way too.
Okay. Well, I'll make sure that all those links are in the description down below so people can get in touch with you. Corinne Mori, thank you so much for coming on the show. It's been just over 3 hours, and we'll call it here, but I'm going to have you back. And I mean, there's always more things to talk. There's so much going on, and not only that, but updates on what's happening with this for the shorter videos as well, not just the podcast. But thanks so much again.
I super enjoyed hanging out with you guys. Thank you.